Section 11 of Gray's Anatomy, Part 3. The common carotid artery. The principal arteries of supply to the head and neck are the two common carotids. They ascend in the neck and each divides into two branches, viz. 1. The external carotid, supplying the exterior of the head, the face, and the greater part of the neck. 2. The internal carotid, supplying to a great extent the parts within the cranial and orbital cavities. The common carotid artery. A. Carotis communis. The common carotid arteries differ in length and in their mode of origin. The right begins at the bifurcation of the innominate artery behind the sternoclavicular joint and is confined to the neck. The left springs from the highest part of the arch of the aorta to the left of and on a plane posterior to the innominate artery, and therefore consists of a thoracic and a cervical portion. The thoracic portion of the left common carotid artery ascends from the arch of the aorta through the superior mediastinum to the level of the left sternoclavicular joint, where it is continuous with the cervical portion. Relations. In front, it is separated from the manubrium sterni by the sternohyoideus and sternothyroideus, the anterior portions of the left pleura and lung, the left innominate vein, and the remains of the thymus. Behind, it lies on the trachea, esophagus, left recurrent nerve, and thoracic duct. To its right side, below is the innominate artery, and above, the trachea, the inferior thyroid veins, and the remains of the thymus. To its left side are the left vagus and phrenic nerves, left pleura, and lung. The left subclavian artery is posterior and slightly lateral to it. The cervical portions of the common carotids resemble each other so closely that one description will apply to both. Each vessel passes obliquely upward from behind the sternoclavicular articulation to the level of the upper border of the thyroid cartilage, where it divides into the external and internal carotid arteries. At the lower part of the neck, the two common carotid arteries are separated from each other by a very narrow interval which contains the trachea, but at the upper part, the thyroid gland, the larynx, and pharynx project forward between the two vessels. The common carotid artery is contained in a sheath, which is derived from the deep cervical fascia and encloses also the internal jugular vein and vagus nerve, the vein lying lateral to the artery, and the nerve between the artery and vein, on a plane posterior to both. On opening the sheath, each of these three structures is seen to have a separate fibrous investment. Relations. At the lower part of the neck, the common carotid artery is very deeply seated, being covered by the integument, superficial fascia, platysma, and deep cervical fascia, the sternocleidomastoideus, sternohyoideus, sternothyroideus, and amohyoideus. In the upper part of its course it is more superficial, being covered merely by the integument, the superficial fascia, platysma, deep cervical fascia, and medial margin of the sternocleidomastoideus. When the latter muscle is drawn backward, the artery is seen to be contained in a triangular space, the carotid triangle, bounded behind by the sternocleidomastoideus, above by the stylohyoideus and posterior belly of the digastricus, and below by the superior belly of the amohyoideus. This part of the artery is crossed obliquely from its medial to its lateral side by the sternocleidomastoid branch of the superior thyroid artery. It is also crossed by the superior and middle thyroid veins, which end in the internal jugular. Descending in front of its sheath is the descending branch of the hypoglossal nerve, this filament being joined by one or two branches from the cervical nerves, which cross the vessel obliquely. Sometimes the descending branch of the hypoglossal nerve is contained within the sheath. The superior thyroid vein crosses the artery near its termination, and the middle thyroid vein a little below the level of the cricoid cartilage. The anterior jugular vein crosses the artery just above the clavicle, but is separated from it by the sternohyoideus and sternothyroideus. Behind, the artery is separated from the transverse processes of the cervical vertebrae by the longus colli and longus capitis, the sympathetic trunk being interposed between it and the muscles. The inferior thyroid artery crosses behind the lower part of the vessel. Medially, it is in relation with the esophagus, trachea, and thyroid gland, which overlaps it. The inferior thyroid artery and recurrent nerve being interposed, higher up, with the larynx and pharynx. Lateral to the artery are the internal jugular vein and vagus nerve. At the lower part of the neck, the right recurrent nerve crosses obliquely behind the artery. The right internal jugular vein diverges from the artery, but the left approaches and often overlaps the lower part of the artery. Behind the angle of bifurcation of the common carotid artery is a reddish-brown oval body known as the glomus caroticum, carotid body. It is similar in structure to the glomus coccygum, coccygeal body, which is situated on the middle sacral artery. Peculiarities as to origin. The right common carotid may arise above the level of the upper border of the sternoclavicular articulation. This variation occurs in about 12% of cases. In other cases, the artery may arise as a separate branch from the arch of the aorta or in conjunction with the left carotid. The left common carotid varies in its origin more than the right. In the majority of abnormal cases, it arises with the innominate artery. If that artery is absent, the two carotids arise usually by a single trunk. It is rarely joined with the left subclavian, except in cases of transposition of the aortic arch. Peculiarities as to point of division. In the majority of abnormal cases, this occurs higher than usual. The artery dividing opposite or even above the hyoid bone. More rarely, it occurs below, opposite the middle of the larynx or the lower border of the cricoid cartilage. One case is related by Morgagni, where the artery was only 4 centimeters in length and divided at the root of the neck. Very rarely, the common carotid ascends in the neck without any subdivision, either the external or the internal carotid being wanting, and in a few cases the common carotid has been found to be absent, the external and internal carotids arising directly from the arch of the aorta. This peculiarity existed on both sides in some instances, on one side in others. Occasional branches. The common carotid usually gives off no branch previous to its bifurcation, but it occasionally gives origin to the superior thyroid or its laryngeal branch, the ascending pharyngeal, the inferior thyroid, or, more rarely, the vertebral artery. Collateral circulation. After ligature of the common carotid, the collateral circulation can be perfectly established by the free communication which exists between the carotid arteries of opposite sides, both without and within the cranium, and by enlargement of the branches of the subclavian artery on the side corresponding to that on which the vessel has been tied. The chief communications outside the skull take place between the superior and inferior thyroid arteries and the profunda cervicis and ramus descendens of the occipital. The vertebral takes the place of the internal carotid within the cranium. End of Section 11. Section 12 of Gray's Anatomy, Part 3. Section 12, Part 1. The external carotid artery. A. Carotis externa. The external carotid artery begins opposite the upper border of the thyroid cartilage, and, taking a slightly curved course, passes upward and forward, and then inclines backward to the space behind the neck of the mandible, where it divides into the superficial temporal and internal maxillary arteries. It rapidly diminishes in size in its course up the neck, owing to the number and large size of the branches given off from it. In the child, it is somewhat smaller than the internal carotid, but in the adult the two vessels are of nearly equal size. At its origin, this artery is more superficial and placed nearer the middle line than the internal carotid, and is contained within the carotid triangle. Relations. The external carotid artery is covered by the skin, superficial fascia, platysma, deep fascia, and anterior margin of the sternocleidomastoideus. It is crossed by the hypoglossal nerve, by the lingual, rhinine, common facial, and superior thyroid veins, and by the digastricus and stylohyoideus. Higher up it passes deeply into the substance of the parotid gland, where it lies deep to the facial nerve and the junction of the temporal and internal maxillary veins. Medial to it are the hyoid bone, the wall of the pharynx, the superior laryngeal nerve, and a portion of the parotid gland. Lateral to it, in the lower part of its course, is the internal carotid artery. Posterior to it, near its origin, is the superior laryngeal nerve, and higher up it is separated from the internal carotid by the styloglossus and stylopharyngeus, the glossopharyngeal nerve, the pharyngeal branch of the vagus, and part of the parotid gland. Branches. The branches of the external carotid artery may be divided into 4 sets. 1. Anterior. Superior thyroid, lingual, external maxillary. 2. Posterior. Occipital, posterior auricular. 3. Ascending, ascending pharyngeal. 4. Terminal. Superficial temporal, internal maxillary. 1. The superior thyroid artery, A. thyroidea superior, arises from the external carotid artery just below the level of the greater cornu of the hyoid bone, and ends in the thyroid gland. Relations. From its origin under the anterior border of the sternocleidomastoideus, it runs upward and forward for a short distance in the carotid triangle, where it is covered by the skin, platysma, and fascia. It then arches downward beneath the omohyoideus, sternohyoideus, and sternothyroideus. To its medial side are the constrictor pharyngeus inferior and the external branch of the superior laryngeal nerve. Branches. It distributes twigs to the adjacent muscles and numerous branches to the thyroid gland, anastomosing with its fellow of the opposite side, and with the inferior thyroid arteries. The branches to the gland are generally 2 in number. 1, the larger, supplies principally the anterior surface on the isthmus of the gland in anastomoses with the corresponding artery of the opposite side. A second branch descends on the posterior surface of the gland and anastomoses with the inferior thyroid artery. Besides the arteries distributed to the muscles and to the thyroid gland, the branches of the superior thyroid are hyoid, sternocleidomastoid, superior laryngeal, cricothyroid. The hyoid branch, ramus hyoideus infrahyoid branch, is small and runs along the lower border of the hyoid bone, beneath the thyrohyoideus and anastomoses with the vessel of the opposite side. The sternocleidomastoid branch, ramus sternocleidomastoideus sternomastoid branch, runs downward and lateralward across the sheath of the common carotid artery, and supplies the sternocleidomastoideus and neighboring muscles and integument. It frequently arises as a separate branch from the external carotid. The superior laryngeal artery, A. laryngea superior, larger than either of the preceding, accompanies the internal laryngeal branch of the superior laryngeal nerve beneath the thyrohyoideus. It pierces the hyothyroid membrane and supplies the muscles, mucous membrane, and glands of the larynx, anastomosing with the branch from the opposite side. The cricothyroid branch, ramus cricothyroideus, is small and runs transversely across the cricothyroid membrane, communicating with the artery of the opposite side. 2. The lingual artery, A lingualis, arises from the external carotid between the superior thyroid and external maxillary. It first runs obliquely upward and medialward to the greater cornu of the hyoid bone. It then curves downward and forward, forming a loop which is crossed by the hypoglossal nerve, and passing beneath the digastricus and the stylohyoideus, it runs horizontally forward, beneath the hyoglossus, and finally, ascending almost perpendicularly to the tongue, turns forward on its lower surface as far as the tip, under the name of the profunda linguae. Relations. Its first or oblique portion is superficial and is contained within the carotid triangle. It rests upon the constrictor pharyngeus medius and is covered by the platysma and the fascia of the neck. Its second or curved portion also lies upon the constrictor pharyngeus medius, being covered at first by the tendon of the digastricus and by the stylohyoideus, and afterward by the hyoglossus. Its third or horizontal portion lies between the hyoglossus and genioglossus. The fourth or terminal part, under the name of the profunda linguae, rhenine artery, runs along the under surface of the tongue to its tip. Here it is superficial, being covered only by the mucous membrane. Above it is the longitudinalis inferior, and on the medial side the genioglossus. The hypoglossal nerve crosses the first part of the lingual artery, but is separated from the second part by the hyoglossus. Branches. The branches of the lingual artery are hyoid, dorsalis linguae, sublingual, profunda linguae. The hyoid branch, ramus hyoideus, suprahyoid branch, runs along the upper border of the hyoid bone, supplying the muscles attached to it and anastomosing with its fellow of the opposite side. The arteriae dorsalis linguae, rami dorsalis linguae, consist usually of 2 or 3 small branches which arise beneath the hyoglossus. They ascend to the back of the dorsum of the tongue and supply the mucous membrane in this situation. The glossopalatine arch, the tonsil, soft palate, and epiglottis, anastomosing with the vessels of the opposite side. The sublingual artery, A sublingualis, arises at the anterior margin of the hyoglossus and runs forward between the genioglossus and mylohyoideus to the sublingual gland. It supplies the gland and gives branches to the mylohyoideus and neighboring muscles, and to the mucous membrane of the mouth and gums. One branch runs behind the alveolar process of the mandible in the substance of the gum to anastomose with a similar artery from the other side. Another pierces the mylohyoideus and anastomoses with the submental branch of the external maxillary artery. The arteria profunda linguae, rhenine artery, deep lingual artery, is the terminal portion of the lingual artery. It pursues a tortuous course and runs along the under surface of the tongue, below the longitudinalis inferior, and above the mucous membrane. It lies on the lateral side of the genioglossus, accompanied by the lingual nerve. At the tip of the tongue, it is said to anastomose with the artery of the opposite side, but this is denied by Hyrtl. In the mouth, these vessels are placed one on either side of the frenulum linguae. 3. The external maxillary artery, A. maxillaris externa, facial artery, arises in the carotid triangle a little above the lingual artery and, sheltered by the ramus of the mandible, passes obliquely up beneath the digastricus and stylohyoideus, over which it arches to enter a groove on the posterior surface of the submaxillary gland. It then curves upward over the body of the mandible at the antero-inferior angle of the masseter, passes forward and upward across the cheek to the angle of the mouth, then ascends along the side of the nose, and ends at the medial commissure of the eye, under the name of the angular artery. This vessel, both in the neck and on the face, is remarkably tortuous. In the former situation, to accommodate itself to the movements of the pharynx in deglutition, and in the latter, to the movements of the mandible, lips, and cheeks. Relations. In the neck, its origin is superficial, being covered by the integument, platysma, and fascia. It then passes beneath the digastricus and stylohyoideus muscles and part of the submaxillary gland, and frequently beneath the hypoglossal nerve. It lies upon the constrictores pharyngeus medius and superior, the latter of which separates it, at the summit of its arch, from the lower and back part of the tonsil. On the face, where it passes over the body of the mandible, it is comparatively superficial, lying immediately beneath the platysma. In its course over the face, it is covered by the integument, the fat of the cheek, and, near the angle of the mouth, by the platysma, rhizorius, and zygomaticus. It rests on the buccinator and caninus, and passes either over or under the infraorbital head of the quadratus labii superioris. The anterior facial vein lies lateral to the artery, and takes a more direct course across the face, where it is separated from the artery by a considerable interval. In the neck it lies superficial to the artery. The branches of the facial nerve cross the artery from behind forward. Branches. The branches of the artery may be divided into two sets, those given off in the neck, cervical, and those on the face, facial. Cervical branches. Ascending palatine, tonsillar, glandular, submental, muscular. Facial branches. Inferior labial, superior labial, lateral nasal, angular, muscular. The ascending palatine artery, A. palatina ascendens, arises close to the origin of the external maxillary artery, and passes up between the styloglossus and stylopharyngeus to the side of the pharynx, along which it is continued between the constrictor pharyngeus superior and the pterogordius internus to near the base of the skull. It divides near the levator villi palatini into two branches. One follows the course of this muscle, and, winding over the upper border of the constrictor pharyngeus superior, supplies the soft palate and the palatine glands, anastomosing with its fellow of the opposite side and with the descending palatine branch of the internal maxillary artery. The other pierces the constrictor pharyngeus superior and supplies the palatine tonsil and auditory tube, anastomosing with the tonsillar and ascending pharyngeal arteries. The tonsillar branch, ramus tonsillaris, ascends between the pterogordius internus and styloglossus, and then along the side of the pharynx, perforating the constrictor pharyngeus superior to ramify in the substance of the palatine tonsil and root of the tongue. The glandular branches, rami glandulari submaxillary branches, consist of 3 or 4 large vessels, which supply the submaxillary gland, some being prolonged to the neighboring muscles, lymph glands, and integument. The submental artery, A. submentalis, the largest of the cervical branches, is given off from the facial artery just as that vessel quits the submaxillary gland. It runs forward upon the mylohyoideus, just below the body of the mandible, and beneath the digastricus. It supplies the surrounding muscles, and anastomoses with the sublingual artery and with the mylohyoid branch of the inferior alveolar. At the symphysis menti, it turns upward over the border of the mandible and divides into a superficial and a deep branch. The superficial branch passes between the integument and quadratus labii inferioris, and anastomoses with the inferior labial artery. The deep branch runs between the muscle and the bone, supplies the lip, and anastomoses with the inferior labial and mental arteries. The inferior labial artery, A. labialis inferior, inferior coronary artery, arises near the angle of the mouth. It passes upward and forward beneath the triangularis and, penetrating the orbicularis oris, runs in a tortuous course along the edge of the lower lip between this muscle and the mucous membrane. It supplies the labial glands, the mucous membrane, and the muscles of the lower lip, and anastomoses with the artery of the opposite side, and with the mental branch of the inferior alveolar artery. The superior labial artery, A labialis superior, superior coronary artery, is larger and more tortuous than the inferior. It follows a similar course along the edge of the upper lip, lying between the mucous membrane and the orbicularis oris, and anastomoses with the artery of the opposite side. It supplies the upper lip and gives off in its course 2 or 3 vessels which ascend to the nose. A septal branch ramifies on the nasal septum as far as the point of the nose, and an alar branch supplies the ala of the nose. The lateral nasal branch is derived from the external maxillary, as that vessel ascends along the side of the nose. It supplies the ala and dorsum of the nose, anastomosing with its fellow, with the septal and alar branches, with the dorsal nasal branch of the ophthalmic, and with the infraorbital branch of the internal maxillary. The angular artery, A angularis, is the terminal part of the external maxillary. It ascends to the medial angle of the orbit, embedded in the fibers of the angular head of the quadratus labii superioris, and accompanied by the angular vein. On the cheek it distributes branches which anastomose with the infraorbital, after supplying the lacrimal sac and orbicularis oculi. It ends by anastomosing with the dorsal nasal branch of the ophthalmic artery. The muscular branches in the neck are distributed to the pterogordius internus and stylohyoideus, and on the face to the masseter and buccinator. The anastomoses of the external maxillary artery are very numerous, not only with the vessel of the opposite side, but in the neck, with the sublingual branch of the lingual, with the ascending pharyngeal, and by its ascending palatine and tonsillar branches with the palatine branch of the internal maxillary. On the face, with the mental branch of the inferior alveolar as it emerges from the mental foramen, with the transverse facial branch of the superficial temporal, with the infraorbital branch of the internal maxillary, and with the dorsal nasal branch of the ophthalmic. Peculiarities. The external maxillary artery not infrequently arises in common with the lingual. It varies in its size and in the extent to which it supplies the face. It occasionally ends at the submental, and not infrequently extends only as high as the angle of the mouth or nose. The deficiency is then compensated for by enlargement of one of the neighboring arteries. 4. The occipital artery, A occipitalis, arises from the posterior part of the external carotid, opposite the external maxillary, near the lower margin of the posterior belly of the digastricus, and ends in the posterior part of the scalp. Course and relations. At its origin, it is covered by the posterior belly of the digastricus and the stylohyoideus, and the hypoglossal nerve winds around it from behind forward. Higher up, it crosses the internal carotid artery, the internal jugular vein, and the vagus and accessory nerves. It next ascends to the interval between the transverse process of the atlas and the mastoid process of the temporal bone, and passes horizontally backward, grooving the surface of the latter bone, being covered by the sternocleidomastoideus, splenius capitis, longissimus capitis, and digastricus, and resting upon the rectus capitis lateralis, the obliquus superior, and semi-spinalis capitis. It then changes its course and runs vertically upward, pierces the fascia connecting the cranial attachment of the trapezius with the sternocleidomastoideus, and ascends in a tortuous course in the superficial fascia of the scalp, where it divides into numerous branches, which reach as high as the vertex of the skull, and anastomose with the posterior auricular and superficial temporal arteries. Its terminal portion is accompanied by the greater occipital nerve. Branches. The branches of the occipital artery are muscular, sternocleidomastoid, auricular, meningeal, descending. The muscular branches, rami muscularis, supply the digastricus, stylohyoideus, splenius, and longissimus capitis. The sternocleidomastoid artery, A. sternomastoid artery, generally arises from the occipital close to its commencement, but sometimes springs directly from the external carotid. It passes downward and backward over the hypoglossal nerve and enters the substance of the muscle, in company with the accessory nerve. The auricular branch, ramus auricularis, supplies the back of the concha and frequently gives off a branch, which enters the skull through the mastoid foramen and supplies the dura mater, the diploe, and the mastoid cells. This latter branch sometimes arises from the occipital artery, and is then known as the mastoid branch. The meningeal branch, ramus meningeus dural branch, ascends from the internal jugular vein and enters the skull through the jugular foramen and condyloid canal to supply the dura mater in the posterior fossa. The descending branch, ramus descendens, arteria princeps cervicis, the largest branch of the occipital, descends on the back of the neck and divides into a superficial and deep portion. The superficial portion runs beneath the splenius, giving off branches which pierce that muscle to supply the trapezius and anastomose with the ascending branch of the transverse cervical. The deep portion runs down between the semispinalis capitis and coli, and anastomoses with the vertebral and with the A profundus cervicalis, a branch of the costocervical trunk. The anastomosis between these vessels assists in establishing the collateral circulation after ligature of the common carotid or subclavian artery. The terminal branches of the occipital artery are distributed to the back of the head. They are very tortuous and lie between the integument and the occipitalis, anastomosing with the artery of the opposite side and with the posterior auricular and temporal arteries, and supplying the occipitalis, the integument, and pericranium. One of the terminal branches may give off a meningeal twig, which passes through the parietal foramen. End of Section 12. Section 13 of Gray's Anatomy, Part 3. The external carotid artery, Part 2. 5. The posterior auricular artery, A. auricularis posterior, is small and arises from the external carotid, above the digastricus and stylohyoideus, opposite the apex of the styloid process. It ascends under cover of the parotid gland, on the styloid process of the temporal bone, to the groove between the cartilage of the ear and the mastoid process, immediately above which it divides into its auricular and occipital branches. Branches. Besides several small branches to the digastricus, stylohyoideus, and sternocleidomastoideus, and to the parotid gland, this vessel gives off 3 branches: stylomastoid, auricular, occipital. The stylomastoid artery, A. stylomastoidea, enters the styloid-mastoid foramen and supplies the tympanic cavity, the tympanic antrum and mastoid cells, and the semicircular canals. In the young subject, a branch from this vessel forms, with the anterior tympanic artery from the internal maxillary, a vascular circle which surrounds the tympanic membrane, and from which delicate vessels ramify on that membrane. It anastomoses with the superficial petrosal branch of the middle meningeal artery by a twig which enters the hiatus canalis fascialis. The auricular branch, ramus auricularis, ascends behind the ear, beneath the auricularis posterior, and is distributed to the back of the auricula, upon which it ramifies minutely, some branches curving around the margin of the cartilage, others perforating it, to supply the anterior surface. It anastomoses with the parietal and anterior auricular branches of the superficial temporal. The occipital branch, ramus occipitalis, passes backward over the sternocleidomastoideus to the scalp above and behind the ear. It supplies the occipitalis and the scalp in this situation and anastomoses with the occipital artery. 6. The ascending pharyngeal artery, A. Pharyngea ascendens, the smallest branch of the external carotid, is a long, slender vessel, deeply seated in the neck, beneath the other branches of the external carotid, and under the stylopharyngeus. It arises from the back part of the external carotid, near the commencement of that vessel, and ascends vertically between the internal carotid and the side of the pharynx, to the undersurface of the base of the skull, lying on the longus capitis. Branches. Its branches are pharyngeal, palatine, prevertebral, inferior tympanic, posterior meningeal. The pharyngeal branches, rami pharyngeae, are 3 or 4 in number. 2 of these descend to supply the constrictores pharyngeus medius and inferior, and the stylopharyngeus, ramifying in their substance and in the mucous membrane lining them. The palatine branch varies in size, and may take the place of the ascending palatine branch of the facial artery, when that vessel is small. It passes inward upon the constrictor pharyngeus superior, sends ramifications to the soft palate and tonsil, and supplies a branch to the auditory tube. The prevertebral branches are numerous small vessels, which supply the longi capitis and coli, the sympathetic trunk, the hypoglossal and vagus nerves, and the lymph glands. They anastomose with the ascending cervical artery. The inferior tympanic artery, A. tympanica inferior, is a small branch which passes through a minute foramen in the petrous portion of the temporal bone, in company with the tympanic branch of the glossopharyngeal nerve, to supply the medial wall of the tympanic cavity and anastomose with the other tympanic arteries. The meningeal branches are several small vessels, which supply the dura mater. 1. The posterior meningeal enters the cranium through the jugular foramen. A second passes through the foramen lacerum, and occasionally a third through the canal for the hypoglossal nerve. The superficial temporal artery, A. temporalis superficialis, the smaller of the 2 terminal branches of the external carotid, appears, from its direction, to be the continuation of that vessel. It begins in the substance of the parotid gland, behind the neck of the mandible, and crosses over the posterior root of the zygomatic process of the temporal bone. About 5 centimeters above this process, it divides into 2 branches, a frontal and a parietal. Relations. As it crosses the zygomatic process, it is covered by the auricularis anterior muscle and by a dense fascia. It is crossed by the temporal and zygomatic branches of the facial nerve and 1 or 2 veins, and is accompanied by the auriculotemporal nerve, which lies immediately behind it. Branches. Besides some twigs to the parotid gland, to the temporomandibular joint, and to the masseter muscle, its branches are transverse facial, middle temporal, anterior auricular, frontal, parietal. The transverse facial artery, A. transversa fascia, is given off from the superficial temporal before that vessel quits the parotid gland. Running forward through the substance of the gland, it passes transversely across the side of the face, between the parotid duct and the lower border of the zygomatic arch, and divides into numerous branches, which supply the parotid gland and duct, the masseter and the integument, and anastomose with the external maxillary, masseteric, buccinator, and infraorbital arteries. This vessel rests on the masseter, and is accompanied by 1 or 2 branches of the facial nerve. The middle temporal artery, A. temporalis media, arises immediately above the zygomatic arch, and, perforating the temporal fascia, gives branches to the temporalis, anastomosing with the deep temporal branches of the internal maxillary. It occasionally gives off a zygomatico-orbital branch, which runs along the upper border of the zygomatic arch, between the 2 layers of the temporal fascia, to the lateral angle of the orbit. This branch, which may arise directly from the superficial temporal artery, supplies the orbicularis oculi, and anastomoses with the lacrimal and palpebral branches of the ophthalmic artery. The anterior auricular branches, rami, auricularis, anteriores, are distributed to the anterior portion of the auricula, the lobule, and part of the external meatus, anastomosing with the posterior auricular. The frontal branch, ramus frontalis, anterior temporal, runs tortuously upward and forward to the forehead, supplying the muscles, integument, and pericranium in this region, and anastomosing with the supraorbital and frontal arteries. The parietal branch, ramus parietalis, posterior temporal, larger than the frontal, curves upward and backward on the side of the head, lying superficial to the temporal fascia, and anastomosing with its fellow of the opposite side, and with the posterior auricular and occipital arteries. 8. The internal maxillary artery, A. maxillaris interna, the larger of the two terminal branches of the external carotid, arises behind the neck of the mandible, and is at first embedded in the substance of the parotid gland. It passes forward between the ramus of the mandible and the sphenomandibular ligament, and then runs, either superficial or deep, to the pterygoideus externus, to the pterygopalatine fossa. It supplies the deep structures of the face, and may be divided into mandibular, pterygoid, and pterygopalatine portions. The first, or mandibular portion, passes horizontally forward, between the ramus of the mandible and the sphenomandibular ligament, where it lies parallel to and a little below the auriculotemporal nerve. It crosses the inferior alveolar nerve and runs along the lower border of the pterygoideus externus. The second, or pterygoid portion, runs obliquely forward and upward under cover of the ramus of the mandible and insertion of the temporalis on the superficial, very frequently on the deep, surface of the pterygoideus externus. It then passes between the two heads of origin of this muscle and enters the fossa. The third, or pterygopalatine portion, lies in the pterygopalatine fossa in relation with the sphenopalatine ganglion. The branches of this vessel may be divided into 3 groups, corresponding with its 3 divisions. Branches of the first, or mandibular portions: anterior tympanic, deep auricular, middle meningeal, accessory meningeal, inferior alveolar. The anterior tympanic artery, A. tympanica anterior, tympanic artery, passes upward behind the temporomandibular articulation, enters the tympanic cavity through the petrotympanic fissure, and ramifies upon the tympanic membrane, forming a vascular circle around the membrane with the stylomastoid branch of the posterior auricular, and anastomosing with the artery of the pterygoid canal, and with the caroticotympanic branch from the internal carotid. The deep auricular artery, A. auricularis profunda, often arises in common with the preceding. It ascends in the substance of the parotid gland, behind the temporomandibular articulation, pierces the cartilaginous or bony wall of the external acoustic meatus, and supplies its cuticular lining and the outer surface of the tympanic membrane. It gives a branch to the temporomandibular joint. The middle meningeal artery, A. meningia media, medidural artery, is the largest of the arteries which supply the dura mater. It ascends between the sphenomandibular ligament and the pterygoideus externus, and between the 2 roots of the auriculotemporal nerve to the foramen spinosum of the sphenoid bone, through which it enters the cranium. It then runs forward in a groove on the great wing of the sphenoid bone, and divides into 2 branches, anterior and posterior. The anterior branch, the larger, crosses the great wing of the sphenoid, reaches the groove or canal in the sphenoidal angle of the parietal bone, and then divides into branches which spread out between the dura mater and internal surface of the cranium, some passing upward as far as the vertex, and others backward to the occipital region. The posterior branch curves backward on the squama of the temporal bone, and, reaching the parietal some distance in front of its mastoid angle, divides into branches which supply the posterior part of the dura mater and cranium. The branches of the middle meningeal artery are distributed partly to the dura mater, but chiefly to the bones. They anastomose with the arteries of the opposite side, and with the anterior and posterior meningeal. The middle meningeal on entering the cranium gives off the following branches. 1. Numerous small vessels supply the semilunar ganglion and the dura mater in this situation. 2. A superficial petrosal branch enters the hiatus of the facial canal, supplies the facial nerve, and anastomoses with the stylomastoid branch of the posterior auricular artery. 3. A superior tympanic artery runs in the canal for the tensor tympani and supplies this muscle and the lining membrane of the canal. 4. Orbital branches pass through the superior orbital fissure or through separate canals in the great wing of the sphenoid to anastomose with the lacrimal or other branches of the ophthalmic artery. 5. Temporal branches pass through foramina in the great wing of the sphenoid and anastomose in the temporal fossa with the deep temporal arteries. The accessory meningeal branch, ramus, meningeus accessorius, small meningeal, or parvidoral branch, is sometimes derived from the preceding. It enters the skull through the foramen ovale and supplies the semilunar ganglion and dura mater. The inferior alveolar artery, A. alveolaris inferior, inferior dental artery, descends with the inferior alveolar nerve to the mandibular foramen on the medial surface of the ramus of the mandible. It runs along the mandibular canal in the substance of the bone, accompanied by the nerve, and opposite the first premolar tooth divides into two branches, incisor and mental. The incisor branch is continued forward beneath the incisor teeth as far as the middle line, where it anastomoses with the artery of the opposite side. The mental branch escapes with the nerve at the mental foramen, supplies the chin, and anastomoses with the submental and inferior labial arteries. Near its origin, the inferior alveolar artery gives off a lingual branch, which descends with the lingual nerve and supplies the mucous membrane of the mouth. As the inferior alveolar artery enters the foramen, it gives off a mylohyoid branch, which runs in the mylohyoid groove and ramifies on the undersurface of the mylohyoideus. The inferior alveolar artery and its incisor branch during their course through the substance of the bone give off a few twigs, which are lost in the cancellous tissue, and a series of branches which correspond in number to the roots of the teeth. These enter the minute apertures at the extremities of the roots and supply the pulp of the teeth. Branches of the second or pterygoid portion: deep temporal, pterygoid, mesenteric, buccinator. The deep temporal branches, 2 in number, anterior and posterior, ascend between the temporalis and the pericranium. They supply the muscle and anastomose with the middle temporal artery. The anterior communicates with the lacrimal artery by means of small branches which perforate the zygomatic bone and great wing of the sphenoid. The pterygoid branches, rami pterygoidae, irregular in their number and origin, supply the pterygoidae. The mesenteric artery, A. mesenterica, is small and passes lateralward through the mandibular notch to the deep surface of the masseter. It supplies the muscle and anastomoses with the mesenteric branches of the external maxillary and with the transverse facial artery. The buccinator artery, A. buccinatoria, buccal artery, is small and runs obliquely forward between the pterygoideus internus and the insertion of the temporalis to the outer surface of the buccinator, to which it is distributed, anastomosing with branches of the external maxillary and with the infraorbital. Branches of the third or pterygopalatine portion. Posterior superior alveolar. Infraorbital. Descending palatine. Artery of the pterygoid canal. Pharyngeal. Sphenopalatine. The posterior superior alveolar artery. A. Alveolaris superior posterior alveolar or posterior dental artery is given off from the internal maxillary, frequently in conjunction with the infraorbital just as the trunk of the vessel is passing into the pterygopalatine fossa. Descending upon the tuberosity of the maxilla, it divides into numerous branches, some of which enter the alveolar canals to supply the molar and premolar teeth and the lining of the maxillary sinus, while others are continued forward on the alveolar process to supply the gums. The infraorbital artery, A. infraorbitalis, appears from its direction to be the continuation of the trunk of the internal maxillary, but often arises in conjunction with the posterior superior alveolar. It runs along the infraorbital groove and canal with the infraorbital nerve, and emerges on the face through the infraorbital foramen, beneath the infraorbital head of the quadratus labii superioris. While in the canal, it gives off A. orbital branches which assist in supplying the rectus inferior and obliquus inferior and the lacrimal sac, and B. anterior superior alveolar branches which descend through the anterior alveolar canals to supply the upper incisor and canine teeth and the mucous membrane of the maxillary sinus. On the face, some branches pass upward to the medial angle of the orbit and the lacrimal sac, anastomosing with the angular branch of the external maxillary artery. Others run toward the nose, anastomosing with the dorsal nasal branch of the ophthalmic, and others descend between the quadratus labii superioris and the caninus, and anastomose with the external maxillary, transverse facial, and buccinator arteries. The four remaining branches arise from that portion of the internal maxillary which is contained in the pterygopalatine fossa. The descending palatine artery, A. palatina descendens, descends through the pterygopalatine canal with the anterior palatine branch of the sphenopalatine ganglion, and, emerging from the greater palatine foramen, runs forward in a groove on the medial side of the alveolar border of the hard palate to the incisive canal. The terminal branch of the artery passes upward through this canal to anastomose with the sphenopalatine artery. Branches are distributed to the gums, the palatine glands, and the mucous membrane of the roof of the mouth, while in the pterygopalatine canal it gives off twigs which descend in the lesser palatine canals to supply the soft palate and palatine tonsil, anastomosing with the ascending palatine artery. The artery of the pterygoid canal, A. canalis pterygoidea, Vidian artery, passes backward along the pterygoid canal with the corresponding nerve. It is distributed to the upper part of the pharynx and to the auditory tube, sending into the tympanic cavity a small branch which anastomoses with the other tympanic arteries. The pharyngeal branch is very small. It runs backward through the pharyngeal canal with the pharyngeal nerve and is distributed to the upper part of the pharynx and to the auditory tube. The sphenopalatine artery, A. sphenopalatine nasopalatine artery, passes through the sphenopalatine foramen into the cavity of the nose at the back part of the superior meatus. Here it gives off its posterior lateral nasal branches which spread forward over the conchae and meatuses, anastomose with the ethmoidal arteries and the nasal branches of the descending palatine, and assist in supplying the frontal, maxillary, ethmoidal, and sphenoidal sinuses. Crossing the undersurface of the sphenoid The sphenopalatine artery ends on the nasal septum as the posterior septal branches. These anastomose with the ethmoidal arteries and the septal branch of the superior labial. One branch descends in a groove on the vomer to the incisive canal and anastomoses with the descending palatine artery. End of section 13.
Section 14 of Gray's Anatomy, Part 3. The side of the neck presents a somewhat quadrilateral outline, limited above by the lower border of the body of the mandible and an imaginary line extending from the angle of the mandible to the mastoid process, below by the upper border of the clavicle, in front by the middle line of the neck, behind by the anterior margin of the trapezius. This space is subdivided into two large triangles by the sternocleidomastoideus, which passes obliquely across the neck from the sternum and clavicle below to the mastoid process and occipital bone above. The triangular space in front of this muscle is called the anterior triangle, and that behind it the posterior triangle. Anterior triangle. The anterior triangle is bounded in front by the middle line of the neck, behind by the anterior margin of the sternocleidomastoideus. Its base, directed upward, is formed by the lower border of the body of the mandible, and a line extending from the angle of the mandible to the mastoid process. Its apex is below, at the sternum. This space is subdivided into four smaller triangles by the digastricus above and the superior belly of the omohyoideus below. These smaller triangles are named the inferior carotid, the superior carotid, the submaxillary, and the suprahyoid. The inferior carotid or muscular triangle is bounded in front by the median line of the neck from the hyoid bone to the sternum, behind by the anterior margin of the sternocleidomastoideus, above by the superior belly of the omohyoideus. It is covered by the integument superficial fascia, platysma, and deep fascia, ramifying in which are some of the branches of the supraclavicular nerves. Beneath these superficial structures are the sternohyoideus and the sternothyroideus, which, together with the anterior margin of the sternocleidomastoideus, conceal the lower part of the common carotid artery. Footnote: Therefore, the common carotid artery and the internal jugular vein are not, strictly speaking, contained in this triangle, since they are covered by the sternocleidomastoideus, that is to say, they lie under that muscle which forms the posterior border of the triangle. But as they lie very close to the structures which are really contained in the triangle, and whose position it is essential to remember in operating on this part of the artery, it is expedient to study the relations of all these parts together. End footnote. This vessel is enclosed within its sheath, together with the internal jugular vein and vagus nerve. The vein lies lateral to the artery on the right side of the neck, but overlaps it below on the left side. The nerve lies between the artery and vein, on a plane posterior to both. In front of the sheath are a few descending filaments from the ansa hypoglossae. Behind the sheath are the inferior thyroid artery, the recurrent nerve, and the sympathetic trunk, and on its medial side, the esophagus, the trachea, the thyroid gland, and the lower part of the larynx. By cutting into the upper part of this space and slightly displacing the sternocleidomastoideus, the common carotid artery may be tied below the omohyoideus. The superior carotid or carotid triangle is bounded behind by the sternocleidomastoideus, below by the superior belly of the omohyoideus, and above by the stylohyoideus and the posterior belly of the digastricus. It is covered by the integument superficial fascia, platysma, and deep fascia, ramifying in which are branches of the facial and cutaneous cervical nerves. Its floor is formed by parts of the thyrohyoideus, hyoglossus, and the constrictors pharyngis medius and inferior. This space, when dissected, is seen to contain the upper part of the common carotid artery, which bifurcates opposite the upper border of the thyroid cartilage into the external and internal carotid. These vessels are somewhat concealed from view by the anterior margin of the sternocleidomastoideus, which overlaps them. The external and internal carotids lie side by side, the external being the more anterior of the two. The following branches of the external carotid are also met with in this space: the superior thyroid running forward and downward, the lingual directly forward, the external maxillary forward and upward, the occipital backward, and the ascending pharyngeal directly upward on the medial side of the internal carotid. The veins met with are the internal jugular, which lies on the lateral side of the common and internal carotid arteries, and veins corresponding to the above-mentioned branches of the external carotid, viz., the superior thyroid, the lingual, common facial, ascending pharyngeal, and sometimes the occipital, all of which end in the internal jugular. The nerves in this space are the following. In front of the sheath of the common carotid is the ramus descendens hypoglossae. The hypoglossal nerve crosses both the internal and external carotids above, curving around the origin of the occipital artery. Within the sheath, between the artery and vein, and behind both, is the vagus nerve. Behind the sheath, the sympathetic trunk. On the lateral side of the vessels, the accessory nerve runs for a short distance before it pierces the sternocleidomastoideus, and on the medial side of the external carotid, just below the hyoid bone, may be seen the internal branch of the superior laryngeal nerve, and still more inferiorly, the external branch of the same nerve. The upper portion of the larynx and lower portion of the pharynx are also found in the front part of this space. The submaxillary or digastric triangle corresponds to the region of the neck immediately beneath the body of the mandible. It is bounded above by the lower border of the body of the mandible and a line drawn from its angle to the mastoid process, below by the posterior belly of the digastricus and the stylohyoideus, in front by the anterior belly of the digastricus. It is covered by the integument, superficial fascia, platysma, and deep fascia, ramifying in which are branches of the facial nerve and ascending filaments of the cutaneous cervical nerve. Its floor is formed by the mylohyoideus, hyoglossus, and constrictor pharyngis superior. It is divided into an anterior and a posterior part by the stylomandibular ligament. The anterior part contains the submaxillary gland, superficial to which is the anterior facial vein, while embedded in the gland is the external maxillary artery and its glandular branches. Beneath the gland, on the surface of the mylohyoideus, are the submental artery and the mylohyoid artery and nerve. The posterior part of this triangle contains the external carotid artery, ascending deeply in the substance of the parotid gland. This vessel lies here in front of and superficial to the internal carotid, being crossed by the facial nerve, and gives off in its course the posterior auricular, superficial temporal, and internal maxillary branches. More deeply are the internal carotid, the internal jugular vein, and the vagus nerve, separated from the external carotid by the styloglossus and the stylopharyngeus, and the glossopharyngeal nerve. Footnote: the remark made about the inferior carotid triangle applies also to this one. The structures enumerated as contained in its posterior part lie, strictly speaking, beneath the muscles which form the posterior boundary of the triangle, but as it is very important to bear in mind their close relation to the parotid gland, all these parts are spoken of together. End footnote. The suprahyoid triangle is limited behind by the anterior belly of the digastricus, in front by the middle line of the neck between the mandible and the hyoid bone, below by the body of the hyoid bone. Its floor is formed by the mylohyoideus. It contains 1 or 2 lymph glands and some small veins. The latter unite to form the anterior jugular vein. Posterior triangle. The posterior triangle is bounded in front by the sternocleidomastoideus, behind by the anterior margin of the trapezius. Its base is formed by the middle third of the clavicle, its apex by the occipital bone. The space is crossed about 2.5 centimeters above the clavicle by the inferior belly of the omohyoideus, which divides it into 2 triangles, an upper or occipital and a lower or subclavian. The occipital triangle, the larger division of the posterior triangle, is bounded in front by the sternocleidomastoideus, behind by the trapezius, below by the omohyoideus. Its floor is formed from the above downward by the splenius capitis, levator scapulae, and the scaleni medius and posterior. It is covered by the skin, the superficial and deep fasciae, and by the platysma below. The accessory nerve is directed obliquely across the space from the sternocleidomastoideus, which it pierces, to the under surface of the trapezius. Below, the supraclavicular nerves and the transverse cervical vessels and the upper part of the brachial plexus cross this space. A chain of lymph glands is also found running along the posterior border of the sternocleidomastoideus from the mastoid process to the root of the neck. The subclavian triangle, the smaller division of the posterior triangle, is bounded above by the inferior belly of the omohyoideus, below by the clavicle. Its base is formed by the posterior border of the sternocleidomastoideus. Its floor is formed by the first rib with the first digitation of the serratus anterior. The size of the subclavian triangle varies with the extent of attachment of the clavicular portions of the sternocleidomastoideus and trapezius, and also with the height at which the omohyoideus crosses the neck. Its height also varies according to the position of the arm, being diminished by raising the limb on account of the ascent of the clavicle, and increased by drawing the arm downward when that bone is depressed. This space is covered by the integument, the superficial and deep fasciae, and the platysma, and crossed by the supraclavicular nerves. Just above the level of the clavicle, the third portion of the subclavian artery curves lateralward and downward from the lateral margin of the scalenus anterior across the first rib to the axilla, and this is the situation most commonly chosen for ligaturing the vessel. Sometimes this vessel rises as high as 4 centimeters above the clavicle. Occasionally, it passes in front of the scalenus anterior or pierces the fibers of that muscle. The subclavian vein lies behind the clavicle and is not usually seen in this space, but in some cases it rises as high as the artery, and has even been seen to pass with that vessel behind the scalenus anterior. The brachial plexus of nerves lies above the artery and in close contact with it. Passing transversely behind the clavicle are the transverse scapular vessels, and traversing its upper angle in the same direction, the transverse cervical artery and vein. The external jugular vein runs vertically downward behind the posterior border of the sternocleidomastoideus to terminate in the subclavian vein. It receives the transverse cervical and transverse scapular veins, which form a plexus in front of the artery, and occasionally a small vein which crosses the clavicle from the cephalic. The small nerve to the subclavius also crosses this triangle about its middle, and some lymph glands are usually found in the space. End of section 14.
Section 15 of Gray's Anatomy, Part 3. The internal carotid artery, arteria carotis interna. The internal carotid artery supplies the anterior part of the brain, the eye and its appendages, and sends branches to the forehead and nose. Its size in the adult is equal to that of the external carotid, though in the child it is larger than that vessel. It is remarkable for the number of curvatures that it presents in different parts of its course. It occasionally has one or two flexures near the base of the skull, while in its passage through the carotid canal and along the side of the body of the sphenoid bone, it describes a double curvature and resembles the italic letter S. Course and relations. In considering the course and relations of this vessel, it may be divided into four portions: cervical, petrous, cavernous, and cerebral. Cervical portion. This portion of the internal carotid begins at the bifurcation of the common carotid, opposite the upper border of the thyroid cartilage, and runs perpendicularly upward, in front of the transverse processes of the upper three vertebrae, to the carotid canal in the petrous portion of the temporal bone. It is comparatively superficial at its commencement, where it is contained in the carotid triangle, and lies behind and lateral to the external carotid, overlapped by the sternocleidomastoideus and covered by the deep fascia, platysma, and integument. It then passes beneath the parotid gland, being crossed by the hypoglossal nerve and the digastricus and stylohyoideus, and the occipital and posterior auricular arteries. Higher up, it is separated from the external carotid by the styloglossus and stylopharyngeus, the tip of the styloid process, and the stylohyoid ligament, the glossopharyngeal nerve, the pharyngeal branch of the vagus. It is in relation, behind, with the longus capitis, the superior cervical ganglion of the sympathetic trunk, and the superior laryngeal nerve. Laterally is the internal jugular vein and vagus nerve, the nerve lying on a plane posterior to the artery. Medially is the pharynx, superior laryngeal nerve, and ascending pharyngeal artery. At the base of the skull, the glossopharyngeal, vagus, accessory, and hypoglossal nerves lie between the artery and the internal jugular vein. Petrous portion. When the internal carotid artery enters the canal in the petrous portion of the temporal bone, it first ascends a short distance, then curves forward and medialward, and again ascends as it leaves the canal to enter the cavity of the skull between the lingula and the petrosal process of the sphenoid. The artery lies at first in front of the cochlear and tympanic cavity. From the latter cavity it is separated by a thin bony lamella, which is cribriform in the young subject, and often partially absorbed in old age. Further forward it is separated from the semilunar ganglion by a thin plate of bone, which forms the floor of the fossa for the ganglion and the roof of the horizontal portion of the canal. Frequently this bony plate is more or less deficient, and then the ganglion is separated from the artery by fibrous membrane. The artery is separated from the bony wall of the carotid canal by a prolongation of dura mater, and is surrounded by a number of small veins and by filaments of the carotid plexus, derived from the ascending branch of the superior cervical ganglion of the sympathetic trunk. Cavernous portion. In this part of its course, the artery is situated between the layers of the dura mater, forming the cavernous sinus, but covered by the lining membrane of the sinus. It at first ascends toward the posterior clinoid process, then passes forward by the side of the body of the sphenoid bone, and again curves upward on the medial side to the anterior clinoid process, and perforates the dura mater, forming the roof of the sinus. This portion of the artery is surrounded by filaments of the sympathetic nerve, and on its lateral side is the abducent nerve. Cerebral portion. Having perforated the dura mater on the medial side of the anterior clinoid process, the internal carotid passes between the optic and oculomotor nerves to the anterior perforated substance at the medial extremity of the lateral cerebral fissure, where it gives off its terminal or cerebral branches. Peculiarities. The length of the internal carotid varies according to the length of the neck. and also according to the point of bifurcation from the common carotid. It arises sometimes from the arch of the aorta. In such rare instances, this vessel has been found to be placed nearer the middle line of the neck than the external carotid, as far upward as the larynx, when the latter vessel crossed the internal carotid. The course of the artery, instead of being straight, may be very tortuous. A few instances are recorded in which this vessel was altogether absent. In one of these, the common carotid passed up the neck and gave off the usual branches of the external carotid. The cranial portion of the internal carotid was replaced by two branches of the internal maxillary, which entered the skull through the foramen rotundum and foramen ovale, and joined to form a single vessel. Branches. The cervical portion of the internal carotid gives off no branches. Those from the other portions are: from the petrous portion, caretico-tympanic, artery of the pterygoid canal; from the cavernous portion, cavernous, hypophyseal, semilunar, anterior meningeal, ophthalmic; from the cerebral portion, anterior cerebral, middle cerebral, posterior communicating, choroidal. 1. The caretico-tympanic branch. Ramus caretico-tympanicus. Tympanic branch is small. It enters the tympanic cavity through a minute foramen in the carotid canal, and anastomosis is the anterior tympanic branch of the internal maxillary and with the stylomastoid artery. 2. The artery of the pterygoid canal, arteria canalis pterygoidae, Vidian artery, is a small, inconstant branch which passes through the pterygoid canal and anastomosis with the branch of the internal maxillary artery. 3. The cavernous branches are numerous small vessels, which supply the hypophysis, the semilunar ganglion, and the walls of the cavernous and inferior petrosal sinuses, some of them anastomosed with branches of the middle meningeal. 4. The hypophyseal branches are one or two minute vessels supplying the hypophysis. 5. The semilunar branches are small vessels to the semilunar ganglion. 6. The anterior meningeal branch, arteria meningia anterior, is a small branch which passes over the small wing of the sphenoid to supply the dura mater of the anterior cranial fossa. It anastomoses with the meningeal branch from the posterior ethmoidal artery. 7. The ophthalmic artery, arteria ophthalmica, arises from the internal carotid just as that vessel is emerging from the cavernous sinus on the medial side of the anterior clinoid process, and enters the orbital cavity through the optic foramen, below and lateral to the optic nerve. It then passes over the nerve to reach the medial wall of the orbit and thence horizontally forward, beneath the lower border of the obliquus superior, and divides it into two terminal branches, the frontal and the dorsal nasal. As the artery crosses the optic nerve, it is accompanied by the nasociliary nerve, and is separated from the frontal nerve by the rectus superior and the levator palpebrae superioris. Branches. The branches of the ophthalmic artery may be divided into an orbital group distributed to the orbit and the surrounding parts, and an ocular group to the muscles and bulb of the eye. Orbital group: lacrimal, supraorbital, posterior ethmoidal, anterior ethmoidal, medial palpebral, frontal, dorsal nasal. Ocular group: central artery of the retina, short posterior ciliary, long posterior ciliary, anterior ciliary, muscular. The lacrimal artery, arteria lacrimalis, arises from the optic foramen, and is one of the largest branches derived from the ophthalmic. Not infrequently, it is given off before the artery enters the orbit. It accompanies the lacrimal nerve along the upper border of the rectus lateralis, and supplies the lacrimal gland. Its terminal branches, escaping from the gland, are distributed to the eyelids and conjunctiva. Of those supplying the eyelids, two are of considerable size and are named the lateral palpebral arteries. They run medialward in the upper and lower lids respectively, and anastomose with the medial palpebral arteries, forming an arterial circle in its situation. The lacrimal artery gives off one or two zygomatic branches, one of which passes through the zygomatico-temporal foramen to reach the temporal fossa and anastomoses with the deep temporal arteries. Another appears on the cheek through the zygomatico-facial foramen, and anastomoses with the transverse facial. A recurrent branch passes backward through the lateral part of the superior orbital fissure to the dura mater, and anastomoses is the branch of the middle meningeal artery. The lacrimal artery is sometimes derived from one of the anterior branches of the middle meningeal artery. And the supraorbital artery, arteria supraorbitalis, springs from the ophthalmic as that vessel is crossing over the optic nerve. It passes upward to the medial borders of the rectus superior and levator palpebrae, and meeting the supraorbital nerve accompanies it between the periostrum and levator palpebrae to the supraorbital foramen. Passing through this, it divides into a superficial and a deep branch, which supply the integument, the muscles, and the pericranium of the forehead, anastomosing with the frontal branch of the superficial temporal, and the artery of the opposite side. This artery in the orbit supplies the rectus superior and the levator palpebrae, and sends a branch across the pulley to the obliquus superior to supply the parts of the medial palpebral commissure. At the supraorbital foramen, it frequently transmits a branch to the diploe. The ethmoidal arteries are two in number, posterior and anterior. The posterior ethmoidal artery, the smaller, passes through the posterior ethmoidal canal, supplies the posterior ethmoidal cells, and, entering the cranium, gives off a meningeal branch to the dura mater and nasal branches which descend into the nasal cavity through the apertures in the cribriform plate, anastomosing with branches of the sphenopalatine. The anterior ethmoidal artery accompanies the nasociliary nerve through the anterior ethmoidal canal, supplies the anterior and middle ethmoidal cells and frontal sinus, and, entering the cranium, gives off a meningeal branch to the dura mater and nasal branches. These latter descend into the nasal cavity through the slit by the side of the crista galli, and running along the groove on the inner surface of the nasal bone, supply branches to the lateral wall and septum of the nose, and the terminal branch which appears on the dorsum of the nose between the nasal bone and the lateral cartilage. The medial palpebral arteries, arteria palpebralis medialis, internal palpebral arteries, two in number, superior and inferior, arise from the ophthalmic, opposite the pulley of the obliquus superior. They leave the orbit to encircle the eyelids near their free margins, forming a superior and an inferior arch, which lie between the orbicularis oculi and the tarsi. The superior palpebral anastomoses at the lateral angle of the orbit is the zygomatic orbital branch of the temporal artery, and with the upper two of the two lateral palpebral branches from the lacrimal artery. The inferior palpebral anastomoses at the lateral angle of the orbit, with the lower of the two lateral palpebral branches from the lacrimal, and with the transverse facial artery, and at the medial part of the lid with a branch from the angular artery. From this last anastomosis, a branch passes to the nasolacrimal duct, ramifying in its mucous membrane as far as the inferior meatus of the nasal cavity. The frontal artery, arteria frontalis, is one of the terminal branches of the ophthalmic, leaves the orbit at its medial angle with the supratrochlear nerve, and ascending to the forehead, supplies the integument, muscles, and pericranium, anastomosing with the supraorbital artery and with the artery of the opposite side. The dorsal nasal artery, arteria dorsalis nasi, nasal artery. The other terminal branch of the ophthalmic emerges from the orbit above the medial palpebral ligament, and, after giving a tweak to the upper part of the lacrimal sac, divides into two branches, one of which crosses the root of the nose and anastomoses with the angular artery. The other runs along the dorsum of the nose, supplies its outer surface and anastomoses with the artery of the opposite side, and with the lateral nasal branch of the external artery. The central artery of the retina, arteria centralis retinae, is the first and one of the smallest branches of the ophthalmic artery. It runs for a short distance within the dural sheath of the optic nerve, but about 2.25 cm behind the eyeball. It pierces the nerve obliquely and runs forward in the center of its substance to the retina. Its mode of distribution will be described with the anatomy of the eye. The ciliary arteries, arteria ciliaris, are divisible into three groups: the long and short, posterior, and the anterior. The short posterior ciliary arteries, from 6 to 12 in number, arise from the ophthalmic or its branches. They pass forward around the optic nerve to the posterior part of the eyeball, pierce the sclera around the entrance of the nerve, and supply the choroid and ciliary processes. The long posterior ciliary arteries, 2 in number, pierce the posterior part of the sclera at some distance from the optic nerve and run forward along either side of the eyeball between the sclera and the choroid to the ciliary muscle, where they divide into two branches. These form an anterior circle, the circulus arteriosus major, around the circumference of the iris, from which numerous converging branches run in the substance of the iris to its pupillary margin, where they form a second arterial circle, the circulus arteriosus minor. The anterior ciliary arteries are derived from the muscular branches. They run to the front of the eyeball in company with the tendons of the recti, form a vascular zone beneath the conjunctiva, and then pierce the sclera a short distance from the cornea and end in the circulus arteriosus major. The muscular branches, rami muscularis, two in number, superior and inferior, frequently spring from a common trunk. The superior, often wanting, supplies the levator palpebrae superioris, rectus superior, and obliquus superior. The inferior, more constantly present, passes forward between the optic nerve and the rectus inferior, and is distributed to the recti lateralis, medialis, and inferior, and the obliquus inferior. This vessel gives off most of the anterior ciliary arteries. Additional muscular branches are given off from the lacrimal and the supraorbital arteries, or form the trunk of the ophthalmic. 8. Anterior cerebral artery, arteria cerebri anterior, arises from the internal carotid at the medial extremity of the lateral cerebral fissure. It passes forward and medialward across the anterior perforated substance above the optic nerve to the commencement of the longitudinal fissure. Here it comes into close relationship with the opposite artery, to which it is connected by a short trunk, the anterior communicating artery. From this point the two vessels run side by side in the longitudinal fissure, curve around the gano of the corpus callosum, and turning backward, continue along the upper surface of the corpus callosum to its posterior part, where they end by anastomosing with the posterior cerebral arteries. Branches. In its course the anterior cerebral artery gives off the following branches: anterior medial ganglionic, anterior, posterior, inferior, and middle. The anterior medial ganglionic branches form a group of small arteries which arise at the commencement of the anterior cerebral artery. They pierce the anterior perforated substance and lamina terminalis, and supply the rostrum of the corpus callosum, the septum pellucidum, and the head of the caudate nucleus. The inferior branches, 2 or 3 in number, are distributed to the orbital surface of the frontal lobe, where they supply the olfactory lobe, gyrus rectus, and internal orbital gyrus. The anterior branches supply a part of the superior frontal gyrus and send twigs over the edge of the hemisphere to the superior and middle frontal gyri and upper part of the anterior central gyrus. The middle branches supply the corpus callosum, the cingulate gyrus, the medial surface of the superior frontal gyrus, and the upper part of the anterior central gyrus. The posterior branches supply the precuneus and adjacent lateral surface of the hemisphere. The anterior communicating artery, arteria communicans anterior, connects the two anterior cerebral arteries across the commencement of the longitudinal fissure. Sometimes this vessel is wanting, the two arteries joining together to form a single trunk which afterward divides, or it may be wholly or partially divided into two. Its length averages about 4 mm, but varies greatly. It gives off some of the intermedial ganglionic vessels, but these are principally derived from the anterior cerebral. 9. The middle cerebral artery, arteria cerebri media, the largest branch of the internal carotid, runs at first lateralward in the lateral cerebral or sylvian fissure, and then backward and upward to the surface of the insula, where it divides into a number of branches which are distributed to the lateral surface of the cerebral hemisphere. Branches. The branches of this vessel are anterolateral ganglionic, inferior lateral frontal, ascending parietal, parietotemporal, and temporal. The anterolateral ganglionic branches, a group of small arteries which arise at the commencement of the middle cerebral artery, are arranged in 2 sets. 1. The internal striate passes upward through the inner segments of the lentiform nucleus and supplies it, the caudate nucleus, and the internal capsule. The other, the external striate, ascends through the outer segment of the lentiform nucleus and supplies the caudate nucleus and thalamus. One artery of this group is of larger size than the rest, and is of special importance, as being the artery in the brain most frequently ruptured. It has been termed by Charcot the artery of cerebral hemorrhage. It ascends between the lentiform nucleus and the external capsule and ends in the caudate nucleus. The inferior lateral frontal supplies the inferior frontal gyrus, Broca's convolution, and the lateral part of the orbital surface of the frontal lobe. The ascending frontal supplies the anterior central gyrus. The ascending parietal is distributed to the posterior central gyrus and the lower part of the superior parietal lobule. The parietotemporal supplies the supramarginal and angular gyri. The parietotemporal supplies the supramarginal and angular gyri and posterior parts of the superior and middle temporal gyri. The temporal branches, 2 or 3 in number, are distributed to the lateral surface of the temporal lobe. 10. The posterior communicating artery, arteria communicans posterior, runs backward from the internal carotid and anastomosis with the posterior cerebral, a branch of the basilar. It varies in size, being sometimes small and occasionally so large that the posterior cerebral may be considered as arising from the internal carotid rather than from the basilar. It is frequently larger on one side than on the other. From its posterior half are given off a number of small branches, the posteromedial ganglionic branches, which, with similar vessels from the posterior cerebral, pierce the posterior perforated substance and supply the medial surface of the thalami and the walls of the third ventricle. 11. The anterior choroidal, anterior choroidea, choroid artery, is a small but constant branch, which arises from the internal carotid near the posterior communicating artery. Passing backward and lateralward between the temporal lobe and the cerebral peduncle, it enters the inferior horn of the lateral ventricle through the choroidal fissure and ends in the choroid plexus. It is distributed to the hippocampus, fimbria, thalachoroidea of the third ventricle and choroid plexus. End of section 15.
Section 16 of Gray's Anatomy, Part 3. The Arteries of the Brain. Since the mode of distribution of the vessels of the brain has an important bearing upon the considerable number of pathological lesions which may occur in this part of the nervous system, it is important to consider a little in more detail the manner in which the vessels are distributed. The cerebral arteries are derived from the internal carotid and vertebral, which at the base of the brain form a remarkable anastomosis known as the arterial circle of Willis. It is formed in front by the anterior cerebral arteries, branches of the internal carotid, which are connected together by the anterior communicating, behind by the 2 posterior cerebral arteries, branches of the basilar, which are connected on either side with the internal carotid by the posterior communicating. The parts of the brain included within this arterial circle are the lamina terminalis, the optic chiasma, the infundibulum, the tuber cinereum, the corpora mammillaria, and the posterior perforated substance. The 3 trunks which together supply each cerebral hemisphere arise from the arterial circle of Willis. From its anterior part proceed the 2 anterior cerebrals. From its anterolateral parts, the middle cerebrals, and from its posterior part, the posterior cerebrals. Each of these principal arteries gives origin to 2 different systems of secondary vessels. One of these is named the ganglionic system, and the vessels belonging to it supply the thalami and corpora striata. The other is the cortical system, and its vessels ramify in the pia mater and supply the cortex and subadjacent brain substance. These 2 systems do not communicate at any point of their peripheral distribution, but are entirely independent of each other, and there is between the parts supplied by the 2 systems a borderland of diminished nutritive activity, where, it is said, softening is especially liable to occur in the brains of old people. The ganglionic system. All the vessels of this system are given off from the arterial circle of Willis, or from the vessels close to it. They form 6 principal groups. 1. The anteromedial group, derived from the anterior cerebrals and anterior communicating. 2. The posteromedial group, from the posterior cerebrals and posterior communicating. 3 and 4, the right and left anterolateral groups, from the middle cerebrals. And 5 and 6, the right and left posterolateral groups, from the posterior cerebrals, after they have wound around the cerebral peduncles. The vessels of this system are larger than those of the cortical system, and are what Kohlheim designated terminal arteries, that is to say, vessels from which their origin to their termination neither supply nor receive any anastomotic branch, so that, through any one of the vessels, only a limited area of the thalamus or corpus striatum can be injected, and the injection cannot be driven beyond the area of the part supplied by the particular vessel which is the subject of the experiment. The cortical arterial system. The vessels forming this system are the terminal branches of the anterior, middle, and posterior cerebral arteries. They divide and ramify in the substance of the pia mater and give off branches which penetrate the brain cortex perpendicularly. These branches are divisible into two classes, long and short. The long or medullary arteries pass through the gray substance and penetrate the subadjacent white substance to the depth of 3 or 4 centimeters without intercommunicating otherwise than by very fine capillaries, and thus constitute so many independent small systems. The short vessels are confined to the cortex, where they form with the long vessels a compact network in the middle zone of the gray substance, the outer and inner zones being sparingly supplied with blood. The vessels of the cortical arterial system are not so strictly terminal as those of the ganglionic system, but they approach this type very closely, so that injection of one area from the vessel of another area, though possible, is frequently very difficult, and is only effected through vessels of small caliber. As a result of this, obstruction of one of the main branches or its divisions may have the effect of producing softening in a limited area of the cortex. End of section 16.
Section number 17 of Gray's Anatomy, Part 3. Arteries of the upper extremity, the subclavian artery, Part 1. The artery which supplies the upper extremity continues as a single trunk from its commencement down to the elbow, but different portions of it have received different names, according to the regions through which they pass. The part of the vessel which extends from its origin to the outer border of the first rib is termed the subclavian. Beyond this point to the lower border of the axilla, it is named the axillary, and from the lower margin of the axillary space to the bend of the elbow it is termed brachial. Here the trunk ends by dividing into two branches, the radial and ulnar. The subclavian artery, arteria subclavia. On the right side, the subclavian artery arises from the innominate artery behind the right sternoclavicular articulation. On the left side, it springs from the arch of the aorta. The two vessels, therefore, in the first part of their course, differ in length, direction, and relation with neighbouring structures. In order to facilitate the description, each subclavian artery is divided into 3 parts. The first portion extends from the origin of the vessel to the medial border of the scalenus anterior. The second lies behind this muscle, and the third extends from the lateral margin of the muscle to the outer border of the first rib, where it becomes the axillary artery. The first portions of the two vessels require separate descriptions. The second and third parts of the two arteries are practically alike. First part of the right subclavian artery. The first part of the right subclavian artery arises from the innominate artery behind the upper part of the right sternoclavicular articulation and passes upward and lateralward to the medial margin of the scalenus anterior. It extends a little above the clavicle, the extent to which it does so varying in different cases. Relations. It is covered, in front, by the integument, superficial fascia, platysma, deep fascia, the clavicular origin of the sternocleidomastoideus, the sternohyoideus, and sternothyreoideus, and another layer of the deep fascia. It is crossed by the internal jugular and vertebral veins, by the vagus nerve and the cardiac branches of the vagus and sympathetic, and by the subclavian loop of the sympathetic trunk which forms a ring around the vessel. The anterior jugular vein is directed lateralward in front of the artery, but is separated from it by the sternohyoideus and sternothyreoideus. Below and behind the artery is the pleura, which separates it from the apex of the lung. Behind is the sympathetic trunk, the longus colli, and the first thoracic vertebra. The right recurrent nerve winds around the lower and back part of the vessel. First part of the left subclavian artery. The first part of the left subclavian artery arises from the arch of the aorta, behind the left common carotid and at the level of the fourth thoracic vertebra. It ascends in the superior mediastinal cavity to the root of the neck and then arches lateralward to the medial border of the scalenus anterior. Relations. It is in relation in front with the vagus, cardiac, and phrenic nerves, which lie parallel with it, the left common carotid artery, left internal jugular and vertebral veins, and the commencement of the left innominate vein, and is covered by the sternothyreoideus, sternohyoideus, and sternocleidomastoideus. Behind, it is in relation with the esophagus, thoracic duct, left recurrent nerve, inferior cervical ganglion of the sympathetic trunk, and longus colli. Higher up, however, the esophagus and thoracic duct lie to its right side, the latter ultimately arching over the vessel to join the angle of union between the subclavian and internal jugular veins. Medial to it are the esophagus, trachea, thoracic duct, and left recurrent nerve. Lateral to it, the left pleura and lung. Second and third parts of the subclavian artery. The second portion of the subclavian artery lies behind the scalenus anterior. It is very short, and forms the highest part of the arch described by the vessel. Relations. It is covered in front by the skin, superficial fascia, platysma, deep cervical fascia, sternocleidomastoideus, and scalenus anterior. On the right side of the neck, the phrenic nerve is separated from the second part of the artery by the scalenus anterior, while on the left side it crosses the first part of the artery close to the medial edge of the muscle. Behind the vessel are the pleura and the scalenus medius, above the brachial plexus of nerves, below the pleura. The subclavian vein lies below and in front of the artery, separated from it by the scalenus anterior. The third portion of the subclavian artery runs downward and lateralward from the lateral margin of the scalenus anterior to the outer border of the first rib, where it becomes the axillary artery. This is the most superficial portion of the vessel, and is contained in the subclavian triangle. Relations. It is covered in front by the skin, the superficial fascia, the platysma, the supraclavicular nerves, and the deep cervical fascia. The external jugular vein crosses its medial part and receives the transverse scapular, transverse cervical, and anterior jugular veins, which frequently form a plexus in front of the artery. Behind the veins, the nerve to the subclavius descends in front of the artery. The terminal part of the artery lies behind the clavicle and the subclavius, and is crossed by the transverse scapular vessels. The subclavian vein is in front of and at a slightly lower level than the artery. Behind, it lies on the lowest trunk of the brachial plexus, which intervenes between it and the scalenus medius. Above and to its lateral side are the upper trunks of the brachial plexus and the omohyoideus. Below, it rests on the upper surface of the first rib. Peculiarities. The subclavian arteries vary in their origin, their course, and the height to which they rise in the neck. The origin of the right subclavian from the innominate takes place, in some cases, above the sternoclavicular articulation, and occasionally, but less frequently, below that joint. The artery may arise as a separate trunk from the arch of the aorta, and in such cases it may be either the first, second, third, or even the last branch derived from that vessel. In the majority, however, it is the first or last, rarely the second or third. When it is the first branch, it occupies the ordinary position of the innominate artery. When the second or third, it gains its unusual position by passing behind the right carotid, and when the last branch, it arises from the left extremity of the arch, and passes obliquely toward the right side, usually behind the trachea, esophagus, and right carotid, sometimes between the esophagus and trachea, to the upper border of the first rib, whence it follows its ordinary course. In very rare instances, this vessel arises from the thoracic aorta, as low down as the fourth thoracic vertebra. Occasionally it perforates the scalenus anterior. More rarely it passes in front of that muscle. Sometimes the subclavian vein passes with the artery behind the scalenus anterior. The artery may ascend as high as 4 cm above the clavicle, or any intermediate point between this and the upper border of the bone, the right subclavian usually ascending higher than the left. The left subclavian is occasionally joined at its origin with the left carotid. The left subclavian artery is more deeply placed than the right in the first part of its course, and, as a rule, does not reach quite as high a level in the neck. The posterior border of the sternocleidomastoideus corresponds pretty closely to the lateral border of the scalenus anterior, so that the third portion of the artery, the part most accessible for operation, lies immediately lateral to the posterior border of the sternocleidomastoideus. Collateral circulation. After ligature of the third part of the subclavian artery, the collateral circulation is established mainly by three sets of vessels, thus described in a dissection. 1. A posterior set, consisting of the transverse scapula and the descending ramus of the transverse cervical branches of the subclavian, anastomosing with the subscapula from the axillary. 2. A medial set, produced by the connection of the internal mammary on the one hand with the highest intercostal and lateral thoracic arteries, and the branches from the subscapula on the other. 3. A middle or axillary set, consisting of a number of small vessels derived from branches of the subclavian, above, and passing through the axilla, terminating either in the main trunk, or some of the branches of the axillary below. This last set presented most conspicuously the peculiar character of newly formed, or rather dilated arteries, being excessively tortuous and forming a complete plexus. The chief agent in the restoration of the axillary artery below the tumour was the subscapular artery, which communicated most freely with the internal mammary, transverse scapula, and descending ramus of the transverse cervical branches of the subclavian, from all of which it received so great an influx of blood as to dilate it to 3 times its natural size. Footnote: Guy's Hospital Reports, Volume 1, 1836, Case of axillary aneurysm, in which Aston Key had tied the subclavian artery on the lateral edge of the scalenus anterior 12 years previously. End of footnote. When a ligature is applied to the first part of the subclavian artery, the collateral circulation is carried on by 1. The anastomosis between the superior and inferior thyroids, 2. The anastomosis of the 2 vertebrals, 3. The anastomosis of the internal mammary with the inferior epigastric and the aortic intercostals, 4. The costocervical anastomosing with the aortic intercostals, 5. The profunda cervicis anastomosing with the descending branch of the occipital, 6. The scapular branches of the thyrocervical trunk anastomosing with the branches of the axillary, and 7. The thoracic branches of the axillary anastomosing with the aortic intercostals. Branches. The branches of the subclavian artery are vertebral, thyrocervical, internal mammary, costocervical. On the left side all 4 branches generally arise from the first portion of the vessel, but on the right side the costocervical trunk usually springs from the second portion of the vessel. On both sides of the neck, the first 3 branches arise close together at the medial border of the scalenus anterior, in the majority of cases. A free interval of from 1.25 to 2.5 cm exists between the commencement of the artery and the origin of the nearest branch. 1. The vertebral artery, arteria vertebralis, is the first branch of the subclavian, and arises from the upper and back part of the first portion of the vessel. It is surrounded by a plexus of nerve fibres derived from the inferior cervical ganglion of the sympathetic trunk, and ascends through the foramina in the transverse processes of the upper 6 cervical vertebrae. Footnote: The vertebral artery sometimes enters the foramen in the transverse process of the 5th vertebra, and has been seen entering that of the 7th vertebra. End of footnote. It then winds behind the superior articular process of the atlas and, entering the skull through the foramen magnum, unites, at the lower border of the pons, with the vessel of the opposite side to form the basilar artery. Relations. The vertebral artery may be divided into 4 parts. The first part runs upward and backward between the longus colli and the scalenus anterior. In front of it are the internal jugular and vertebral veins, and it is crossed by the inferior thyroid artery. The left vertebral is crossed by the thoracic duct also. Behind it are the transverse process of the 7th cervical vertebra, the sympathetic trunk, and its inferior cervical ganglion. The second part runs upward through the foramina in the transverse processes of the upper 6 cervical vertebrae, and is surrounded by branches from the inferior cervical sympathetic ganglion and by a plexus of veins which unite to form the vertebral vein at the lower part of the neck. It is situated in front of the trunks of the cervical nerves, and pursues an almost vertical course as far as the transverse process of the atlas, above which it runs upward and lateralward to the foramen in the transverse process of the atlas. The third part issues from the latter foramen on the medial side of the rectus capitis lateralis, and curves backward behind the superior articular process of the atlas, the anterior ramus of the first cervical nerve being on its medial side. It then lies in the groove on the upper surface of the posterior arch of the atlas, and enters the vertebral canal by passing between the posterior atlanto-occipital membrane. This part of the artery is covered by the semispinalis capitis, and is contained in the suboccipital triangle, a triangular space bounded by the rectus capitis posterior major, the obliquus superior, and the obliquus inferior. The first cervical or suboccipital nerve lies between the artery and the posterior arch of the atlas. The fourth part pierces the dura mater and inclines medialward to the front of the medulla oblongata. It is placed between the hypoglossal nerve and the anterior root of the first cervical nerve, and beneath the first digitation of the ligamentum denticulatum. At the lower border of the pons, it unites with the vessel of the opposite side to form the basilar artery. Branches. The branches of the vertebral artery may be divided into two sets, those given off at the neck and those within the cranium. Cervical branch, spinal, cranial branches, meningeal. Cervical branch, muscular, cranial branches, posterior spinal, anterior spinal, posterior inferior cerebellar, medullary. Spinal branches, rami spinalis, enter the vertebral canal through the intervertebral foramina, and each divides into two branches. Of these, one passes along the roots of the nerves to supply the medulla spinalis and its membranes, anastomosing with the other arteries of the medulla spinalis. The other divides into an ascending and a descending branch, which unite with similar branches from the arteries above and below, so that two lateral anastomotic chains are formed on the posterior surfaces of the bodies of the vertebrae, near the attachment of the pedicles. From these anastomotic chains branches are supplied to the periosteum and the bodies of the vertebrae, and others form communications with similar branches from the opposite side. From these communications small twigs arise which join similar branches above and below, to form a central anastomotic chain on the posterior surface of the bodies of the vertebrae. Muscular branches are given off to the deep muscles of the neck, where the vertebral artery curves around the articular process of the atlas. They anastomose with the occipital and with the ascending and deep cervical arteries. The meningeal branch, ramus meningeus, posterior meningeal branch, springs from the vertebral, opposite the foramen magnum, ramifies between the bone and dura mater in the cerebellar fossa, and supplies the falx cerebelli. It is frequently represented by one or two small branches. The posterior spinal artery, A spinalis posterior, dorsal spinal artery, arises from the vertebral, at the side of the medulla oblongata. Passing backward, it descends on this structure, lying in front of the posterior roots of the spinal nerves, and is reinforced by a succession of small branches, which enter the vertebral canal through the intervertebral foramina. By means of these it is continued to the lower part of the medulla spinalis, and to the cauda equina. Branches from the posterior spinal arteries form a free anastomosis around the posterior roots of the spinal nerves, and communicate, by means of very tortuous transverse branches, with the vessels of the opposite side. Close to its origin, each gives off an ascending branch, which ends at the side of the fourth ventricle. The anterior spinal artery, arteria spinalis anterior, ventral spinal artery, is a small branch which arises near the termination of the vertebral, and, descending in front of the medulla oblongata, unites with its fellow of the opposite side at the level of the foramen magnum. One of these vessels is usually larger than the other, but occasionally they are about equal in size. The single trunk thus formed descends on the front of the medulla spinalis, and is reinforced by a succession of small branches which enter the vertebral canal through the intervertebral foramina. These branches are derived from the vertebral and the ascending cervical of the inferior thyroid at the neck, from the intercostalis in the thorax, and from the lumbar, iliolumbar, and lateral sacral arteries in the abdomen and pelvis. They unite by means of ascending and descending branches to form a single anterior median artery, which extends as far as the lower part of the medulla spinalis, and is continued as a slender twig on the filum terminale. This vessel is placed in the pia mater along the anterior median fissure. It supplies that membrane and the substance of the medulla spinalis, and sends off branches at its lower part to be distributed to the cauda equina. The posterior inferior cerebellar artery, arteria cerebelli inferior posterior, the largest branch of the vertebral, winds backward around the upper part of the medulla oblongata, passing between the origins of the vagus and accessory nerves, over the inferior peduncle to the undersurface of the cerebellum, where it divides into two branches. The medial branch is continued backward to the notch between the two hemispheres of the cerebellum, while the lateral supplies the undersurface of the cerebellum, as far as its lateral border, where it anastomoses with the anterior inferior cerebellar and the superior cerebellar branches of the basilar artery. Branches from this artery supply the choroid plexus of the fourth ventricle. The medullary arteries, bulbar arteries, are several minute vessels which spring from the vertebral and its branches, and are distributed to the medulla oblongata. End of section number 17. Section 18 of Gray's Anatomy, Part 3. The Subclavian Artery, Part 2. The basilar artery, Arteria basilaris, so named from its position at the base of the skull, is a single trunk formed by the junction of the two vertebral arteries. It extends from the lower to the upper border of the pons, lying in its median groove, under cover of the arachnoid. It ends by dividing into the two posterior cerebral arteries. Its branches on either side are the following: pontine, anterior inferior cerebellar, internal auditory, superior cerebellar, posterior cerebral. The pontine branches, rami ad pontem, transverse branches, are a number of small vessels which come off at right angles from either side of the basilar artery and supply the pons and adjacent parts of the brain. The internal auditory artery, arterius auditiva interna, auditory artery, a long slender branch, arises from near the middle of the artery. It accompanies the acoustic nerve through the internal acoustic meatus, and is distributed to the internal ear. The anterior inferior cerebellar artery, arterius cerebelli inferior anterior, passes backward to be distributed to the anterior part of the undersurface of the cerebellum, anastomosing with the posterior inferior cerebellar branch of the vertebral. The superior cerebellar artery, arterius cerebelli superior, arises near the termination of the basilar. It passes lateralward immediately below the oculomotor nerve, which separates it from the posterior cerebral artery, winds around the cerebral peduncle close to the trochlear nerve, and, arriving at the upper surface of the cerebellum, divides into branches which ramify in the pia mater and anastomose with those of the inferior cerebellar arteries. Several branches are given to the pineal body, the anterior medullary velum and the tela choroidea of the third ventricle. The posterior cerebral artery, arteria cerebri posterior, is larger than the preceding, from which it is separated near its origin by the oculomotor nerve. Passing lateralward, parallel to the superior cerebellar artery, and receiving the posterior communicating from the internal carotid, it winds around the cerebral peduncle and reaches the tentorial surface of the occipital lobe of the cerebrum, where it breaks up into branches for the supply of the temporal and occipital lobes. The branches of the posterior cerebral artery are divided into two sets, ganglionic and cortical. Ganglionic, posterior medial, posterior choroidal, posterolateral. Cortical, anterior temporal, posterior temporal, calcarine, parieto-occipital. Ganglionic. The posteromedial ganglionic branches are a group of small arteries which arise at the commencement of the posterior cerebral artery. These, with similar branches from the posterior communicating, pierce the posterior perforated substance, and supply the medial surfaces of the thalami and the walls of the third ventricle. Posterior choroidal branches run forward beneath the splenium of the corpus callosum, and supply the tela choroidea of the third ventricle and the choroid plexus. The posterolateral ganglionic branches are small arteries which arise from the posterior cerebral artery after it has turned around the cerebral peduncle. They supply a considerable portion of the thalamus. Cortical, The cortical branches are the anterior temporal, distributed to the uncus and the anterior part of the fusiform gyrus, the posterior temporal, to the fusiform and the inferior temporal gyri, the calcarine, to the cuneus and gyrus lingualis and the back part of the convex surface of the occipital lobe, and the parieto-occipital, to the cuneus and the precuneus. 2. The thyrocervical trunk, truncus thyrocervicalis, thyroid axis, is a short, thick trunk which arises from the front of the first portion of the subclavian artery, close to the medial border of the scalenus anterior, and divides almost immediately into 3 branches: the inferior thyroid, transverse scapular, and transverse cervical. The inferior thyroid artery, arteria thyroidea inferior, passes upward in front of the vertebral artery and longus colli, then turns medialward behind the carotid sheath and its contents, and also behind the sympathetic trunk, the middle cervical ganglion resting upon the vessel. Reaching the lower border of the thyroid gland, it divides into 2 branches, which supply the postero-inferior parts of the gland, and anastomose with the superior thyroid and with the corresponding artery of the opposite side. The recurrent nerve passes upward generally behind, but occasionally in front of the artery. The branches of the inferior thyroid are inferior laryngeal, tracheal, esophageal, ascending cervical, muscular. The inferior laryngeal artery, arteria laryngea inferior, ascends upon the trachea to the back part of the larynx under cover of the constrictor pharyngis inferior, in company with the recurrent nerve, and supplies the muscles and mucous membrane of this part, anastomosing with the branch from the opposite side and with the superior laryngeal branch of the superior thyroid artery. The tracheal branches, rami trachealis, are distributed upon the trachea, and anastomose below with the bronchial arteries. The esophageal branches, rami esophagi, supply the esophagus and anastomose with the esophageal branches of the aorta. The ascending cervical artery, arteria cervicalis ascendens, is a small branch which arises from the inferior thyroid as that vessel is passing behind the carotid sheath. It runs up on the anterior tubercles of the transverse processes of the cervical vertebrae in the interval between the scalenus anterior and longus capitis. To the muscles of the neck it gives twigs which anastomose with branches of the vertebral, and it sends 1 or 2 spinal branches into the vertebral canal through the intervertebral foramina to be distributed to the medulla spinalis and its membranes, and to the bodies of the vertebrae, in the same manner as the spinal branches from the vertebral. It anastomoses with the ascending pharyngeal and occipital arteries. The muscular branches supply the depressors of the hyoid bone and the longus colli, scalenus anterior, and constrictor pharyngis inferior. The transverse scapular artery, arteria transversa scapulae suprascapular artery, passes at first downward and lateralward across the scalenus anterior and phrenic nerve, being covered by the sternocleidomastoideus. It then crosses the subclavian artery and the brachial plexus, and runs behind and parallel with the clavicle and the subclavius, and beneath the inferior belly of the omohyoideus, to the superior border of the scapula. It passes over the superior transverse ligament of the scapula, which separates it from the suprascapular nerve, and enters the supraspinatus fossa. In this situation it lies close to the bone, and ramifies between it and the supraspinatus, to which it supplies branches. It then descends behind the neck of the scapula, through the great scapular notch and under cover of the inferior transverse ligament, to reach the infraspinatus fossa, where it anastomoses with the scapular circumflex and the descending branch of the transverse cervical. Besides distributing branches to the sternocleidomastoideus, subclavius, and neighbouring muscles, it gives off a suprasternal branch, which crosses over the sternal end of the clavicle to the skin of the upper part of the chest, and an acromial branch, which pierces the trapezius and supplies the skin over the acromion, anastomosing with the thoracoacromial artery. As the artery passes over the superior transverse ligament of the scapula, it sends a branch into the subscapular fossa, where it ramifies beneath the subscapularis, and anastomoses with the subscapular artery, and with the descending branch of the transverse cervical. It also sends articular branches to the acromioclavicular and shoulder joints, and a nutrient artery to the clavicle. The transverse cervical artery, arteria transversa colli, transversalis colli artery, lies at a higher level than the transverse scapula. It passes transversely above the inferior belly of the omohyoideus to the anterior margin of the trapezius, beneath which it divides into an ascending and a descending branch. It crosses in front of the phrenic nerve and the scalene, and in front of or between the divisions of the brachial plexus, and is covered by the platysma and sternocleidomastoideus, and crossed by the omohyoideus and trapezius. The ascending branch, ramus ascendens, superficial cervical artery, ascends beneath the anterior margin of the trapezius, distributing branches to it and to the neighbouring muscles and lymph glands in the neck, and anastomosing with the superficial branch of the descending ramus of the occipital artery. The descending branch, ramus descendens, posterior scapular artery, passes beneath the levator scapulae to the medial angle of the scapula, and then descends under the rhomboideae along the vertebral border of that bone as far as the inferior angle. It supplies the rhomboideae, latissimus dorsi, and trapezius, and anastomosis with the transverse scapular and subscapular arteries, and with the posterior branches of some of the intercostal arteries. Peculiarities. The ascending branch of the transverse cervical frequently arises directly from the thyrocervical trunk, and the descending branch from the third, more rarely from the second, part of the subclavian. The internal mammary artery, arteria mammaria interna, arises from the under surface of the first portion of the subclavian, opposite the thyrocervical trunk. It descends behind the cartilages of the upper 6 ribs at a distance of about 1.25 cm from the margin of the sternum, and at the level of the 6th intercostal space divides into the musculophrenic and superior epigastric arteries. Relations. It is directed at first downward, forward, and medialward behind the sternal end of the clavicle, the subclavian and internal jugular veins, and the first costal cartilage, and passes forward close to the lateral side of the innominate vein. As it enters the thorax, the phrenic nerve crosses from its lateral to its medial side. Below the first costal cartilage it descends almost vertically to its point of bifurcation. It is covered in front by the cartilages of the upper 6 ribs and the intervening intercostales interni and anterior intercostal membranes, and is crossed by the terminal portions of the upper 6 intercostal nerves. It rests on the pleura as far as the 3rd costal cartilage, below this level upon the transversus thoracis. It is accompanied by a pair of veins. These unite above to form a single vessel, which runs medial to the artery and ends in the corresponding innominate vein. Branches. The branches of the internal mammary are pericardiacophrenic, anterior mediastinal, pericardial, sternal, intercostal, perforating, musculophrenic, superior epigastric. The pericardiacophrenic artery, arteria pericardiacophrenica, arteria comes nervi phrenici, is a long slender branch which accompanies the phrenic nerve between the pleura and pericardium to the diaphragm, to which it is distributed. It anastomoses with the musculophrenic and inferior phrenic arteries. The anterior mediastinal arteries, AA mediastinalis anteriores, mediastinal arteries, are small vessels distributed to the areolar tissue and lymph glands in the anterior mediastinal cavity and to the remains of the thymus. The pericardial branches supply the upper part of the anterior surface of the pericardium. The lower part receives branches from the musculophrenic artery. The sternal branches, rami sternalis, are distributed to the transversus thoracis and to the posterior surface of the sternum. The anterior mediastinal, pericardial, and sternal branches, together with some twigs from the pericardiacophrenic, anastomose with branches from the intercostal and bronchial arteries, and form a subpleural mediastinal plexus. The intercostal branches, rami intercostalis, anterior intercostal arteries, supply the upper 5 or 6 intercostal spaces. 2 in number in each space, these small vessels pass lateralward, one lying near the lower margin of the rib above, and the other near the upper margin of the rib below, and anastomose with the intercostal arteries from the aorta. They are at first situated between the pleura and the intercostales interni, and then between the intercostales interni and externi. They supply the intercostales, and by branches which perforate the intercostales externi, the pectorales and the mamma. The perforating branches, rami perforantes, correspond to the 5 or 6 intercostal spaces. They pass forward through the intercostal spaces and, curving lateralward, supply the pectoralis major and the integument. Those which correspond to the second, third, and fourth spaces give branches to the mamma, and during lactation are of large size. The musculophrenic artery, arteria musculophrenica, is directed obliquely downward and lateralward, behind the cartilages of the false ribs. It perforates the diaphragm at the 8th or 9th costal cartilage, and ends, considerably reduced in size, opposite the last intercostal space. It gives off intercostal branches to the 7th, 8th, and 9th intercostal spaces. These diminish in size as the spaces decrease in length, and are distributed in a manner precisely similar to the intercostals from the internal mammary. The musculophrenic also gives branches to the lower part of the pericardium, and others which run backward to the diaphragm, and downward to the abdominal muscles. The superior epigastric artery, arteria epigastrica superior, continues in the original direction of the internal mammary. It descends through the interval between the costal and sternal attachments of the diaphragm, and enters the sheath of the rectus abdominis, at first lying behind the muscle, and then perforating and supplying it, and anastomosing with the inferior epigastric artery from the external iliac. Branches perforate the anterior wall of the sheath of the rectus, and supply the muscles of the abdomen and the integument, and a small branch passes in front of the xiphoid process and anastomoses with the artery of the opposite side. It also gives some twigs to the diaphragm, while from the artery of the right side small branches extend into the falciform ligament of the liver, and anastomose with the hepatic artery. The costicocervical trunk, truncus costicocervicalis, superior intercostal artery, arises from the upper and back part of the subclavian artery, behind the scalenus anterior on the right side, and medial to that muscle on the left side. Passing backward, it gives off the profunda cervicalis, and, continuing as the highest intercostal artery, descends behind the pleura in front of the necks of the first and second ribs, and anastomoses with the first aortic intercostal. As it crosses the neck of the first rib, it lies medial to the anterior division of the first thoracic nerve, and lateral to the first thoracic ganglion of the sympathetic trunk. In the first intercostal space, it gives off a branch which is distributed in a manner similar to the distribution of the aortic intercostals. The branch for the second intercostal space usually joins with one from the highest aortic intercostal artery. This branch is not constant, but is more commonly found on the right side. When absent, its place is supplied by an intercostal branch from the aorta. Each intercostal gives off a posterior branch which goes to the posterior vertebral muscles, and sends a small spinal branch through the corresponding intervertebral foramen to the medulla spinalis and its membranes. The profunda cervicalis, arteria cervicalis profunda, deep cervical branch, arises in most cases from the costocervical trunk, and is analogous to the posterior branch of an aortic intercostal artery. Occasionally it is a separate branch from the subclavian artery. Passing backward, above the 8th cervical nerve and between the transverse process of the 7th cervical vertebra and the neck of the first rib, it runs up the back of the neck, between the semispinalis capitis and colli, as high as the axis vertebra, supplying these and adjacent muscles, and anastomosing with the deep division of the descending branch of the occipital and with branches of the vertebral. It gives off a spinal twig which enters the canal through the intervertebral foramen between the 7th cervical and 1st thoracic vertebra. End of section 18.
Section 19 of Gray's Anatomy Part 3. The axilla, the axillary artery. 4b. The axilla. The axilla is a pyramidal space situated between the upper lateral part of the chest and the medial side of the arm. Boundaries. The apex, which is directed upward toward the root of the neck, corresponds to the interval between the outer border of the first rib, the superior border of the scapula, and the posterior surface of the clavicle, and through it the axillary vessels and nerves pass. The base, directed downward, is broad at the chest but narrow and pointed at the arm. It is formed by the integument and the thick layer of the fascia, the axillary fascia, extending between the lower border of the pectoralis major in front and the lower border of the latissimus dorsi behind. The anterior wall is formed by the pectoralis major and minor, the former covering the whole of this wall, and the latter only its central part. The space between the upper border of the pectoralis minor and the clavicle is occupied by the coracoclavicular fascia. The posterior wall, which extends somewhat lower than the anterior, is formed by the subscapularis above the teres major and the latissimus dorsi below. On the medial side are the first 4 ribs, with their corresponding intercostals, and part of the serratus anterior. On the lateral side, where the anterior and posterior walls converge, the space is narrow, and bounded by the humerus, the coraco brachialis, and the biceps brachii. Contents. It contains the axillary vessels and the brachial plexus of nerves, with their branches, some branches of the intercostal nerves, together with a quantity of fat and loose areolar tissue. The axillary artery and vein, with the brachial plexus of nerves, extend obliquely along the lateral boundary of the axilla, from its apex to its base, and are placed much nearer to the anterior than the posterior wall, the vein lying to the thoracic side of the artery and partially concealing it. At the forepart of the axilla, in contact with the pectoralis, are the thoracic branches of the axillary artery, and along the lower margin of the pectoralis minor, the lateral thoracic artery extends to the side of the chest. At the back part, in contact with the lower margin of the subscapularis, are the subscapular vessels and nerves. Binding around the lateral border of this muscle are the scapular circumflex vessels, and close to the neck of the humerus, the posterior humeral circumflex vessels, and the axillary nerve curve backward to the shoulder. Along the medial or thoracic side no vessel of importance exists, the upper part of the space being crossed merely by a few small branches from the highest thoracic artery. There are some important nerves, however, in this situation, viz. The long thoracic nerve, descending on the surface of the serratus anterior, to which it is distributed, and the intercostobrachial nerve, perforating the upper and anterior part of this wall, and passing across the axilla to the medial side of the arm. The position and arrangement of the lymph glands are described on pages 699 and 700. 1. The axillary artery, the continuation of the subclavian, commences at the outer border of the first rib, and ends at the lower border of the tendon of the teres major, where it takes the name of brachial. Its direction varies with the position of the limb. Thus, the vessel is nearly straight when the arm is directed at right angles with the trunk, concave upward when the arm is elevated above this, and convex upward and lateralward when the arm lies by the side. At its origin, the artery is very deeply situated, but near its termination is superficial, being covered only by the skin and fascia. To facilitate the description of the vessel, it is divided into 3 portions. The first part lies above, the second behind, and the third below the pectoralis minor. Relations. The first portion of the axillary artery is covered anteriorly by the clavicular portion of the pectoralis major and the coracoclavicular fascia, and is crossed by the lateral anterior thoracic nerve and the thoracicoacromial and cephalic veins. Posterior to it are the first intercostal space, the corresponding intercostalis externus, the first and second digitations of the serratus anterior, and the long thoracic and medial anterior thoracic nerves, and the medial cord of the brachial plexus. On its lateral side is the brachial plexus, from which it is separated by a little areolar tissue. On its medial or thoracic side is the axillary vein, which overlaps the artery. It is enclosed together with the axillary vein and the brachial plexus in a fibrous sheath, the axillary sheath, continuous above with the deep cervical fascia. The second portion of the axillary artery is covered anteriorly by the pectoralis major and minor. Posterior to it are the posterior cord of the brachial plexus and some areolar tissue, which intervenes between it and the subscapularis. On the medial side is the axillary vein, separated from the artery by the medial cord of the brachial plexus and the medial anterior thoracic nerve. On the lateral side is the lateral cord of the brachial plexus. Brachial plexus thus surrounds the artery on 3 sides and separates it from direct contact with the vein and adjacent muscles. The third portion of the axillary artery extends from the lower border of the pectoralis minor to the lower border of the tendon of the teres major. In front it is covered by the lower part of the pectoralis major above, but only by the integument and fascia below. Behind it is in relation with the lower part of the subscapularis and the tendons of the latissimus dorsi and the teres major. On its lateral side is the coracobrachialis, and on its medial or thoracic side the axillary vein. The nerves of the brachial plexus bear the following relations to this part of the artery. On the lateral side are the lateral head and the trunk of the median, on the musculocutaneous for a short distance, on the medial side the ulna between the vein and the artery, and the medial brachial cutaneous on the medial side of the vein. In front are the medial head of the median and the medial antebrachial cutaneous, and behind the radial and axillary, the latter only as far as the lower border of the subscapularis. Collateral circulation of the ligature of the axillary artery. If the artery be tied above the origin of the thoracoacromial, the collateral circulation will be carried on by the same branches as after the ligature on the third part of the subclavian. If at the lower point between the thoracoacromial and the subscapular, the lateral vessel, by its free anastomosis with the transverse scapula and the transverse cervical branches of the subclavian, will become the chief agent in carrying on the circulation. The lateral thoracic, if it be below the ligature, will materially contribute by its anastomosis with the intercostal and internal mammary arteries. If the point included in the ligature is below the origin of the subscapular artery, it will most probably also be below the origins of the two humeral circumflex arteries. The chief agents in restoring the circulations will then be the subscapular and the two humeral circumflex arteries, anastomosing with the arteria profunda brachii. Branches. Branches of the maxillary are: from first part, highest thoracic; from second part, thoracoacromial, lateral thoracic; from third part, subscapular, posterior humeral circumflex, anterior humeral circumflex. 1. The highest thoracic artery, arteria thoracalis suprema, superior thoracic artery, is a small vessel which may arise from the thoracoacromial, running forward and medialward along the upper border of the pectoralis minor. It passes between it and the pectoralis major to the side of the chest. It supplies branches to these muscles and to the parties of the thorax and anastomosis with the internal mammary and intercostal arteries. 2. The thoracoacromial artery, arteria thoracoacromialis, acromiothoracic artery, thoracic axis, is a short trunk which arises from the forepart of the axillary artery, its origin being generally overlapped by the upper edge of the pectoralis minor. Projecting forward to the upper border of this muscle, it pierces the coracoclavicular fascia and divides it into 4 branches: pectoral, acromial, clavicular, and deltoid. The pectoral branch descends between the two pectoralis and is distributed to them and to the mamma, anastomosing with the intercostal branches of the internal mammary and with the lateral thoracic. The acromial branch runs lateralward over the coracoid process and under the deltoideus, to which it gives branches. It then pierces the muscle and ends in the acromion in an arterial network formed by branches from the transverse scapular, thoracoacromial, and posterior humeral circumflex arteries. The clavicular branch runs upward and medialward to the sternoclavicular joint, supplying this articulation and the subclavius. The deltoid humeral branch, often arising with the acromial, crosses over the pectoralis minor and passes in the same groove as the cephalic vein, between the pectoralis major and deltoideus, and gives branches to both muscles. 3. The lateral thoracic artery, arteria thoracalis lateralis, long thoracic artery, external mammary artery, follows the lower border of the pectoralis minor to the side of the chest, supplying the serratus anterior and the pectoralis, and sending branches across the axilla to the axillary glands and the subscapularis. It anastomoses with the internal mammary, subscapular, and intercostal arteries, and with the pectoral branch of the thoracoacromial. In the female, it supplies the external mammary branch, which turns around the free edge of the pectoralis major and supplies the mamma. 4. The subscapular artery, arteria subscapularis. The largest branch of the axillary artery arises at the lower border of the subscapularis, which it follows to the inferior angle of the scapula, where it anastomoses with the lateral thoracic and intercostal arteries, and with the descending branch of the transverse cervical, and ends in the neighboring muscles. About 4 centimeters from its origin it gives off a branch, the scapular circumflex artery. The scapular circumflex artery, arteria circumflexa scapulae, dorsalis scapulae artery, is generally larger than the continuation of the subscapular. It curves around the axillary border of the scapula, traversing the space between the subscapularis above, teres major below, and the long head of the triceps laterally. It enters the infraspinatus fossa, under cover of the teres minor, and anastomoses with the transverse scapular artery and the descending branch of the transverse cervical. In its course it gives off 2 branches, 1. Infrascapular, enters the subscapular fossa beneath the subscapularis, which it supplies, anastomosing with the transverse scapular artery and the descending branch of the transverse cervical. The other is continued along the axillary border of the scapula, between the teres major and minor, and at the dorsal surface of the inferior angle anastomosis with the descending branch of the transverse cervical. In addition to these, small branches are distributed to the back part of the deltoideus and the long head of the triceps brachii, anastomosing with the ascending branch of the arteria profunda brachii. 5. The posterior humeral circumflex artery, arteria circumflexa humeri posterior, posterior circumflex artery, arises from the axillary artery at the lower border of the subscapularis and runs backward with the axillary nerve through the quadrangular space bounded by the subscapularis and teres minor above, the teres major below, the long head or the triceps brachii medially, and the surgical neck of the humerus laterally. It winds around the neck of the humerus and is distributed to the deltoideus and shoulder joint, anastomosing with the anterior humeral circumflex and profunda brachii. 6. The anterior humeral circumflex artery, arteria circumflexa humeri anterior, anterior circumflex artery, considerably smaller than the posterior, arises nearly opposite it, from the lateral side of the axillary artery. It runs horizontally beneath the coracobrachialis and short head of the biceps brachii in front of the neck of the humerus. On reaching the intertubercular sulcus, it gives off a branch which ascends the sulcus to supply the head of the humerus and the shoulder joint. The trunk of the vessel is then continued onward beneath the long head of the biceps brachii and the deltoideus, and anastomosis with the posterior humeral circumflex artery. Peculiarities. The branches of the axillary artery vary considerably in different subjects. Occasionally, the subscapular, humeral circumflex, and profunda arteries arise from a common trunk, and when this occurs, the branches of the brachial plexus surround this trunk instead of the main vessel. Sometimes the axillary artery divides into the radial and ulnar arteries, and occasionally it gives origin to the volar interosseous artery of the forearm. End of section 19.
Section 20 of Gray's Anatomy, Part 3, the Brachial Artery. 4b. The Brachial Artery. A. Brachialis. The brachial artery commences at the lower margin of the tendon of the teres major, and, passing down the arm, ends about 1 centimeter below the bend of the elbow, where it divides into the radial and ulnar arteries. At first the brachial artery lies medial to the humerus, but as it runs down the arm it gradually gets in front of the bone, and at the bend of the elbow it lies midway between its two epicondyles. Relations. The artery is superficial throughout its entire extent, being covered in front by the integument and the superficial and deep fascia. The laceratus fibrosus, bicipital fascia, lies in front of it opposite the elbow, and separates it from the vena mediana cubiti. The median nerve crosses from its lateral to its medial side opposite the insertion of the coracobrachialis. Behind, it is separated from the long head of the triceps brachii by the radial nerve and A profunda brachii. It then lies upon the medial head of the triceps brachii, next upon the insertion of the coracobrachialis, and lastly on the brachialis. Laterally, it is in relation above with the median nerve and the coracobrachialis, below with the biceps brachii, the two muscles overlapping the artery to a considerable extent. Medially, its upper half is in relation with the medial antebrachial cutaneous and ulnar nerves, its lower half with the median nerve. The basilic vein lies on its medial side, but is separated from it in the lower part of the arm by the deep fascia. The artery is accompanied by two venae comitants, which lie in close contact with it, and are connected together at intervals by short transverse branches. The antecubital fossa. At the bend of the elbow, the brachial artery sinks deeply into a triangular interval, the antecubital fossa. The base of the triangle is directed upward, and is represented by a line connecting the two epicondyles of the humerus. The sides are formed by the medial edge of the brachioradialis and the lateral margin of the pronator teres. The floor is formed by the brachialis and supinator. This space contains the brachial artery, with its accompanying veins, the radial and ulnar arteries, the median and radial nerves, and the tendon of the biceps brachii. The brachial artery occupies the middle of the space and divides opposite the neck of the radius into the radial and ulnar arteries. It is covered in front by the integument, the superficial fascia, and the vena mediana cubiti, the last being separated from the artery by the lacertus fibrosus. Behind it is the brachialis, which separates it from the elbow joint. The median nerve lies close to the medial side of the artery above, but is separated from it below by the ulnar head of the pronator teres. The tendon of the biceps brachii lies to the lateral side of the artery. The radial nerve is situated upon the supinator and concealed by the brachioradialis. Peculiarities of the brachial artery as regards its course. The brachial artery, accompanied by the median nerve, may leave the medial border of the biceps brachii and descend toward the medial epicondyle of the humerus. In such cases it usually passes behind the supracondylar process of the humerus, from which a fibrous arch is in most cases thrown over the artery. It then runs beneath or through the substance of the pronator teres to the bend of the elbow. This variation bears considerable analogy with the normal condition of the artery in some of the carnivora. It has been referred to in the description of the humerus. As regards its division, occasionally the artery is divided for a short distance at its upper part into two trunks, which are united below. Frequently the artery divides at a higher level than usual, and the vessels concerned in this high division are three, viz., radial, ulnar, and interosseous. Most frequently the radial is given off high up, the other limb of the bifurcation consisting of the ulnar and interosseous. In some instances the ulnar rises above the ordinary level, and the radial and interosseous form the other limb of the division. Occasionally the interosseous arises high up. Sometimes long, slender vessels, vasa aberrantia, connect the brachial or the axillary artery with one of the arteries of the forearm or branches from them. These vessels usually join the radial. Varieties in muscular relations. The brachial artery is occasionally concealed in some part of its course by muscular or tendinous slips derived from the coracobrachialis, biceps brachii, brachialis, or pronator teres. Collateral circulation. After the application of a ligature to the brachial artery and the upper third of the arm, the circulation is carried on by branches from the humeral circumflex and subscapular arteries, anastomizing with ascending branches from the profunda brachii. If the artery be tied below the origin of the profunda brachii and superior ulnar collateral, the circulation is maintained by the branches of these two arteries anastomosing with the inferior ulnar collateral, the radial and ulnar recurrents, and the dorsal interosseous. Branches. The branches of the brachial artery are profunda brachii, superior ulnar collateral, nutrient, inferior ulnar collateral, muscular. 1. The arteria profunda brachii, superior profunda artery, is a large vessel which arises from the medial and back part of the brachial, just below the lower border of the teres major. It follows closely the radial nerve, running at first backward between the medial and lateral heads of the triceps brachii, then along the groove for the radial nerve, where it is covered by the lateral head of the triceps brachii to the lateral side of the arm. There it pierces the lateral intermuscular septum, and, descending between the brachioradialis and the brachialis to the front of the lateral epicondyle of the humerus, ends by anastomosing with the radial recurrent artery. It gives branches to the deltoideus and to the muscles between which it lies. It supplies an occasional nutrient artery which enters the humerus behind the deltoid tuberosity. A branch ascends between the long and lateral heads of the triceps brachii to anastomose with the posterior humeral circumflex artery. A middle collateral branch descends in the middle head of the triceps brachii and assists in forming the anastomosis above the olecranon, and lastly, a radial-collateral branch runs down behind the lateral intermuscular septum to the back of the lateral epicondyle of the humerus, where it anastomoses with the interosseous recurrent and the inferior ulnar collateral arteries. 2. The nutrient artery, A. nutritia humeri, of the body of the humerus, arises about the middle of the arm and enters the nutrient canal near the insertion of the coracobrachialis. 3. The superior ulnar collateral artery, A. collateralis ulnaris superior, inferior profunda artery, of small size, arises from the brachial a little below the middle of the arm. It frequently springs from the upper part of the A. profunda brachii. It pierces the medial intermuscular septum and descends on the surface of the medial head of the triceps brachii to the space between the medial epicondyle and olecranon, accompanied by the ulnar nerve, and ends under the flexor carpi ulnaris by anastomosing with the posterior ulnar recurrent and inferior ulnar collateral. It sometimes sends a branch in front of the medial epicondyle to anastomose with the inferior ulnar recurrent. 4. The inferior ulnar collateral artery, A. collateralis ulnaris inferior, anastomotica magna artery, arises about 5 cm above the elbow. It passes medialward upon the brachialis, and piercing the medial intermuscular septum, winds around the back of the humerus between the triceps brachii and the bone, forming, by its junction with the profunda brachii, an arch above the olecranon fossa. As the vessel lies on the brachialis, it gives off branches which ascend to join the superior ulnar collateral. Others descend in front of the medial epicondyle to anastomose with the anterior ulnar recurrent. Behind the medial epicondyle, a branch anastomoses with the superior ulnar collateral and posterior ulnar recurrent arteries. 5. The muscular branches, rami muscularis, 3 or 4 in number, are distributed to the coracobrachialis, biceps brachii, and brachialis. The anastomosis around the elbow joint. The vessels engaged in this anastomosis may be conveniently divided into those situated in front of and those behind the medial and lateral epicondyles of the humerus. The branches anastomosing in front of the medial epicondyle are the anterior branch of the inferior ulnar collateral, the anterior ulnar recurrent, and the anterior branch of the superior ulnar collateral. Those behind the medial epicondyle are the inferior ulnar collateral, the posterior ulnar recurrent, and the posterior branch of the superior ulnar collateral. The branches anastomosing in front of the lateral epicondyle are the radial recurrent and the terminal part of the profunda brachii. Those behind the lateral epicondyle, perhaps more properly described as being situated between the lateral epicondyle and the olecranon, are the inferior ulnar collateral, the interosseous recurrent, and the radial collateral branch of the profunda brachii. There is also an arch of anastomosis above the olecranon formed by the interosseous recurrent joining with the inferior ulnar collateral and posterior ulnar recurrent. End of section 20,